Good morning from Eastern Virginia Medical School. Please stand by. This meeting will begin momentarily. Good morning from Eastern Virginia Medical School. Please stand by. This meeting will begin momentarily.
Gotcha.
See this room? Do they see me?
Yes.
It is so good to finally see some faces.
Yeah, absolutely.
Good.
Okay, we are good to proceed.
Dr. Martin, you're clear to start.
Thank you very much. Good morning, everybody. I am chairman of the Academic and Student Affairs Committee of the Board of Visitors, and I call this meeting to order June 9th, 2020, 10 a.m. Good morning, and thank you all for attending. We're meeting by electronic means today, as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held entirely in open session. It is being live streamed and recorded. All votes today will be done by roll call. Now, some of the items for approval we'll take individually and some will be grouped. The first item on the agenda is approval of the minutes of March 10th, 2020. Yolanda Boatwright and I have reviewed the minutes on several occasions and we made necessary corrections. Let me ask if there are additional corrections or discussions regarding the minutes.
Dr. Martin,
Hearing
just a
none,
small correction. Dr.
Go
Martin,
ahead.
there's a typo in the spelling of my first name. There's only one E, not two.
Okay. Okay, we will remove that second
I'll
E.
make that
Thank you,
correction, sir.
Dr. Jeffrey.
Thank you.
Thank you. So with that correction, is there a motion to approve the minutes?
So moved.
Second?
Second.
Second.
Is there a second? Thank you. Yolanda, will you call out the roll call for vote?
Yes, sir. Mr. Frame, Miss Goodwyn,
Approved.
Dr. Husani,
Aye.
Mr. Hughley's,
I approve.
Dr. Joffrey,
Aye.
Dr. Lindsay, Dr. Lindsay, Dr. Martin,
Yes.
and Dr. Waldholtz.
Yes.
And Dr. Emory is here now too. The invitation went to the wrong email. So sorry for being late.
Welcome. Glad you got on.
Yeah.
So we've called the roll, Yolanda?
Yes, sir.
Okay, the minutes are now approved. Thank you. Next, we'll have a report from Vice Provost for Faculty Affairs and Institutional Effectiveness, Dr. Elza Mylona. Dr. Mylona.
Thank you. Good morning. So today we are seeking endorsement of 4 promotions of faculty. 2 of these faculty, Drs. Hooper and Harrell, are full-time salaried faculty that went through successful review by the Appointment and Promotion Committee from assistant to associate. The other 2 faculty are full-time non-salary that went through, again, a successful review by the Appointment and Promotion Committee, again from assistant to associate, and I'm seeking endorsement of those 4 appointments.
Thank you. Any questions or concerns on these appointments? In your packet of material, we all received strong letters of support for each of these individuals to be promoted from assistant professor to associate professor. And let's see, Dr. Mylona, if you don't mind, I think we'll go ahead and take a vote on the promotions, appointments and promotions at this time, and then we'll ask you to review the new center. So we have promotions of full-time and salaried faculty members. They are Dr. Brooke Hooper, Dr. Paul Harrell, Dr. Brian Modi, and Dr. Jessica DeLong. Is there a motion to approve?
Motion.
Second?
Second.
Second.
Thank you. Yolanda, would you please call the roll, the vote?
Yes. Mr. Frame? Ms. Goodwyn?
Aye.
Dr. Hussaini?
Aye.
Mr. Hughley?
Aye.
Dr. Joffrey?
Aye.
Dr. Lindsay? Dr. Martin?
Yes.
Dr. Waldholtz?
Yes.
Don't forget me.
Okay, thank you,
That's it.
And Dr. Emory.
Dr.
Dr. Emory. Sorry.
Did we get a yes from Dr. Emory?
Yes.
Okay, thank you.
Sorry,
Thank you
Dr.
all.
Emory.
So the appointments and promotions approved. Now, Dr. Mylona, would you discuss the EVMS Facial Nerve Center, please?
Yes, thank you. Thank you. So we are also seeking endorsement of the proposal that was submitted by the Department of ENT to create a comprehensive facial nerve center, which will be able to integrate and expand on the current available services at EVMS and Centara. The proposal was submitted for your review, and as stated there is no other comprehensive facial nerve center that is available for patients in the state of Virginia. So the center will offer services throughout the community, this community first, but has the capacity and the opportunity to expand and gain regional recognition. The proposal was reviewed and approved by the Faculty Senate back in April, and we're seeking your endorsement. Any questions?
Thank you. Thank you, Dr. Mylona. Anybody have questions? So just as a note, Dr. Mylona, so the center will include surgical, non-surgical, radiological, neurologic rehabilitation services, and as you mentioned, no other center, comprehensive center in the state. So this will be an
Yes.
accomplishment. Any other
And we have
comments or
already
questions?
recruited faculty, wonderful, with great expertise, and there is no financial obligations from the school at this point.
Wonderful. Comments, questions? So, is there a motion to approve the EVMS Facial Nerve Center?
So moved.
Second?
Second.
Thank you. Yolanda? It's been moved and
Yes.
seconded, so Yolanda, please roll call for a vote.
Yes. Dr. Emory?
Yes.
Mr. Frame? Ms. Goodwyn?
Yes.
Dr. Hussaini?
Yes.
Mr. Hughley?
Yes.
Dr. Joffrey?
Yes.
Dr. Lindsay? Dr. Martin?
Yes.
Dr. Waldholtz?
Yes.
We're done with that one, Dr. Martin.
Emory?
Yes,
How about
I
Dr.
called
Emory?
her first.
He called me first,
Yeah.
but I like to be called twice. That's good.
Want to make sure everybody-
We're making up for last time.
Right. Moved and approved, and a unanimous vote to approve the new EVMS Facial Nerve Center. Congratulations, Dr. Mylona. Thank you very much for your report. Do you have any other items you want to report to us?
No, thank you very much.
Thank you. Next, we hear a report from the Vice Dean for Academic Affairs, Dr. Ronald Flenner. Dr. Flenner.
Yes, good morning again. Just a few items to update the group on events that have occurred and results that we have available since our last meeting. To start with, we had a match in March of this year, and our initial match rate was 94%. After SOAP, it was 99%. So of the cohort, there were only 2 students at the conclusion of SOAP who do not have positions. They continue to look for positions and remain in communication with either me or Dr. Hooper to explore possibilities. So a successful match rate for and results for the class of 2020, which also graduated on May 16th of this year. Like all other schools, it was a virtual graduation. The feedback we received was predominantly positive. The events folks did a fantastic job of, I think, putting together a virtual graduation for the class of 2020. For our third year students, we'll have them we've been working with a task force that Dr. Combs has led with many participants to re-engage in clinical learning here at EVMS. And our first cohort is anticipated to start on Monday, the 15th of June. And that will include some M3 students who are going to have an opportunity to engage in clinical education that they were unable to because of COVID. So they will be beginning some rotations on Monday. There are about 40 of them who have elected to return to clinical education at that time, after which there will be a sequential involvement of students in clinical education to include the M4s engaging in additional electives, and then on August the 17th, the M3 class will begin their clinical education. Will actually begin their education on the 17th of August. So a comprehensive plan has been developed under the leadership of Dr. Combs and the task force, and has been distributed to our partners at Centera and CHKD, all of whom are in agreement with the students re-engaging in clinical education. As a result of the COVID impact on clinical education, the ERAS, which is the application service for students to apply to residencies, historically has opened September 15th. This year it has been delayed until October 21st. So students will have more time to secure letters of recommendation and bolster their application prior to submission. So it's now October 21st instead of September the 15th. Additionally, while Step 2 clinical skills has been a requirement for applying to residencies because of the logistics associated with the COVID and an inability for students to complete that actually has been canceled by the NBME this year, and we are taking it to the MEC to remove it as a graduation requirement for at least a waiver for this year. It's impossible for students to complete Step 2 CS or clinical skills this year. Those that have completed it will be refunded their money from the NBME, and those that haven't won't obviously be required to complete the Step 2 CS. We have a School of Medicine medical transfer policy, which Dr. Martin, I'm not sure if that's going to require approval here or not, but basically part of the LCME document that we're preparing for submission. I wanted to review our transfer policy. In the past, we've rarely accepted transfer students. On those occasions that we have, they've been to the M3 year almost exclusively over the history of the school, and the policy would limit it to accepting students into the M3 year and not any earlier or later than that year in their curriculum. And then lastly, just an update for our LCME process. Our data collection instrument, or DCI, the document is continuing to be reviewed. We're meeting this Friday all day virtually with our consultants to review the entire document. And it will be submitted on July 1st with all the supporting documents, including all the policies that are related to the standards, etc. So it continues to be refined, and we'll get the feedback from our consultants on an all-day meeting on our visit has been changed from an on-site visit to a virtual visit, with the dates still being October 4th. It will be a two-part visit. They will have a virtual contact me to identify the areas they want to discuss on the virtual visit, which will be on October the 4th. If they have questions or are not satisfied with the results of the virtual visit, then they will then make an in-person visit at a time to be determined. So they will let us know when they will be visiting the campus to further address, investigate any questions that they may have that aren't sufficiently answered with the document we submit and or the virtual visit that we will have on October the 4th. So it'll be far more abbreviated than it has been in years past, and they're going to want to meet with fewer people than they have historically, with a smaller survey team when they do actually come to campus to visit. So those are the updates that I have.
Yeah, thank you so much. Just one question for the 2020-21 return on grounds education. The timeline that you just discussed, would you make that available to us? Perhaps, Donna, you could just send that to the committee, so we will have that, so we can have an understanding and know what you just said and can follow that. And the other thought is for the EVMS, yes, is that okay? You'll be able to forward that to us?
Yes, sir.
Okay, thanks. So EVMS School of Medicine Medical Student Transfer Policy, that's well written. I understand the Medical Education Committee has approved it, and I'm not presenting it to the BOV for approval today. It's not on the agenda for approval there, so I don't think that our Academic and Student Affairs Committee has to approve it either, based on conversations with you earlier and with Yolanda. Is that correct?
I think that is correct. It's informational only. These are the policies that are approved by the Medical Education Committee, just for FYI.
Yeah, they're more or less considered to be operational policies rather than high-level board policies.
Right. Gotcha. Thank you. Any questions for Dr. Flenner? Okay. Thank you. Next, we'll move to Dr. Flenner, report. Yeah.
I just had one quick question about the medical students returning. When are they going to return to the clinical rotations that are outside of the hospital, as far as the community rotations?
Those are on the same schedule. They'll be returning to the community rotations. The 40 students that we have who are coming back Monday are all going to be out there at Centera or CHKD. But after that, on July the 6th, some of them are likely to be engaged in the clinical, surrounding clinical arenas as well.
Okay, thank you.
And is that for both the MD program and the health professions program?
Yes, Dr. Combs can speak to that, but yes, it's a unified plan, basically.
Essentially, we have about 80 students, 40 MD students and 40 health profession students in 4 disciplines who were not able to do everything they needed to have done by either graduation or the normal end of the spring semester. So we're ramping them up first, which is now June 15th. And then shortly after that, we'll resume normal rotations for all of our programs. And so far, the preceptors, the only real issue has been making sure that we understand their PPE requirements, and that we're providing all of that to students. But obviously, each site may have slightly different expectations, and so we're learning about those and responding.
Dr. Flenner, just a quick question on the 2 students who have not matched. Is that a typical number after the SOAP? And is there any policy on recommending that those students do not graduate to give them a chance to do something to bolster their application? And I guess the other question would be, was there anything that would have predicted based on the academic record that they might not have matched? Because obviously it's a personal tragedy to invest 4 years and all this money and not become a practicing physician at the other end.
Yeah, so to tackle the multiple parts of your question, yes, that's not atypical for schools to have 1 or 2 students who don't match even after the SOAP secure position. So 1 or 2 is not out of the norm. Is there anything that could have been done in terms of offering them deferred graduation? Actually, one student had already deferred graduation, so that individual was not eligible for a further deferment, which tells you that there were some problems with the application the first time, and there were. For the second individual, they too were offered the opportunity or option of deferring graduation, but elected to graduate and go through the match this year. Were there any signs or evidence that they were going to encounter problems? Yes, both individuals had encountered some either professional or academic challenges throughout their time here at EVMS, and had met with various committees, including the Student Review and Advisory Committee, as well as the Student Progress Committee. One of them did, at least in the past. So not terribly surprising that either one are in the position that they are.
Thank you.
All right. Thank you again, Dr. Flenner.
Sure.
Next, we will move to the report from the Associate Dean for Student Affairs, Dr. Allison Knight. Dr. Knight.
Good morning, everyone. I have 3 policies we are asking for your input and approval. Is somebody trying to speak? Okay. I am going to attempt to share my screen so that I can show you the PowerPoint. We will see if it works. There you go. All right. Hopefully, is everybody seeing that?
Yes.
Okay. This is very quick. I thought it would, because I want to just highlight why we're asking. So these are all we were asking or for your approval for the following 3 policies. These are all policies that are needed for the LCME accreditation. They have been in existence for a while, and I also think it's important, aside from the accreditation process, that we just have board support for campus-wide policies that involve the student learning environment. So the first is the Compact for the Teacher-Learner Relationship. This is an interesting document. It's actually a document that many schools, I will say, adopted years ago in response to having a standard language around the relationship, the behavioral expectations and the attitudinal expectations around the relationships between faculty and learners. We adapted it. I'm not sure exactly when, because it's been in our institutional handbook as long as I've been here, to include the health profession students. To me, it's been a little bit complicated because it's honestly, as you can see, it's a fairly outdated document by now, but all schools are still using it as originally, or most schools are still using it as originally written. Thanks to, and Josephine Wiley and I have gone back and forth about it, but I think after some feedback from Ms. Goodwyn yesterday, we decided that it was best to align the language with the new anti-discrimination policy that is coming in front of the board. And so the original language is what's on the left-hand side of the screen. We have simply, where it's used to say regard to gender, race, national origin, blah, 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 we have replaced that language with the exact language that's in the anti-discrimination policy so that we are fully aligned. The next is the non-involvement of healthcare provider in education. This is an LCME requirement, and it should be that students be seen for their medical and psychiatric and psychological care by somebody who is not involved in their education. We have actually, have had many schools, ours is slightly broader in that we would also not want a student to rotate with somebody who was their provider in a different context outside of student health. Sometimes that may inadvertently occur, and then we will, as soon as it's identified, we would address it, but we're trying to prevent it up front to protect the students and to protect that very important provider-patient relationship. And then the last is the student rights to a professional learning environment. This is our mistreatment policy. Again, this has evolved over the last couple of years to be much cleaner, much more explicit, clear processes. And again, this applies to all students at EVMS. And so it has been in place, and we're asking for your approval for it now. I believe that's it. Hopefully I will, let me see if I bring that down. And I don't know if anybody has
would
questions.
you repeat it? So the change in language for the compact for the teacher-learner relationship, that was taken again from AAMC?
The original language is from the AAMC, and that's what I'm saying. It's an almost 20-year-old document at this point, and it was wonderful at the time, but it's gotten outdated just in terms of what's, like, there's no mention of disability, there's no mention of gender orientation. There are several things, transgender, there are several things that have been left out of that original document. And so we have substituted the language for our new anti-discrimination policy that I believe the board is voting on today, the full board.
Oh, gotcha. That makes sense. Any other questions?
Yeah, Allison, this is Linda Archer. Can you send me a copy of that policy so I can align mine with yours? Because we have the residents sign the compact for teacher and learner. And
absolutely.
And they actually sign it annually. So if you'll send that to me, I'll update ours as well.
Thank you so much.
You're welcome.
Hi, Allison. I had a quick question as well. In the teacher-student relationship, you mentioned students also rotating and making sure that they're not aligned with a potential provider. Is there any concern about students rotating with, healthcare providers and seeing other fellow students? And is there any concern about that? And is there a provision in the policy about that?
Can you explain? I'm not sure I'm following your questions. You could.
Yeah, so when you were talking about making sure that our students are not being seen and treated by their teachers, I think you also mentioned that we are also making sure that those same students are not rotating with the same providers that give them health care. And what I was curious about is whether there is a policy or concern about students rotating with those healthcare providers and seeing their fellow students and learning about, their fellow students' healthcare issues.
So I don't think that would, I'm not sure, I apologize, because any student would not be rotating with their own healthcare provider. So, and it's also in the policy that students can't provide care to another student.
Yeah.
So
okay, that's why I just wanted to make sure. Okay.
Yeah.
So I haven't reviewed that entire policy. Okay.
Right. I can foresee a situation where somebody ended up in the ER one night, and so there was no way we would know in advance, and so that's clearly in the policy.
Okay, got it. Thanks.
Thank you. Yeah.
Dr. Thank you. So we have 3 proposed policies for approval: compact for the teacher-learner relationship, non-involvement of healthcare provider education, student rights to professional learning environment. Any further discussion or questions? Okay, if not, I'll ask for a motion to approve all 3 of these policies.
Motion.
Second. Thank you. It's been moved and seconded. Yolanda, roll call, please, for a vote.
Yes. Dr. Emory,
Yes.
Mr. Frame, Ms. Goodwyn,
Yes.
Dr. Hussaini,
Yes.
Mr. Hughley,
Yes.
Dr. Joffrey,
Yes.
Dr. Lindsay,
Yes.
Dr. Martin,
Yes.
and Dr. Waldholtz.
Yes.
Okay, heard from everybody. Unanimous approval. Thank you. So the 3 proposed policies have been approved by our committee. So the next report, and again, thank you, Dr. Knight, for your report. So the next one is a report from the VP and Dean of the School of Health Professions, Dr. Combs.
Yes, thank you, Mr. Chairman. Several things on the agenda. HP update, basically we're probably at the 80% level in terms of recruitment for students for next year, and so far that's looking very positive across the board. I mean, some programs will be down, some up, but in the aggregate, I think we're either on target or slightly ahead of target. So that's good. I should have mentioned, I didn't put on the agenda, but since we last met, we were supposed to have had a site visit from SACS. They were scheduled to be here on March 31st, and we were turning it into a virtual visit on March 24th, and then on March 25th, they delayed it until February the 16th to the 19th. At this point, the idea is that it would be the same team and the same materials with, of course, we never presented the QEP plan, which is a big part of the site visit, but in terms of the information that we provided, we do not have to update that, or at least they have not instructed us that we have, because accreditation always takes place at a point in time, and our point in time was the end of the fiscal year before last. And so I think that we've sent them information for all the questions that the site visit had, but just everything's put on hold. So I would expect that we would hear from them the latter part of December or the first of the year about specifically what we need to do. In the meantime, we've done all the things you do, reserve hotel rooms and meeting rooms and so on, and basically assume that the agenda that we had set for the end of March, we will now do the middle of February. But I did want to let you know about that. They did that across the board, obviously in response to COVID. I have 4 proposals for new educational programs for you. I think information was included in the board packet. The first and the largest is a Master of Health Administration degree. For those of you that may not be familiar with that domain, there are, generally speaking, 3 major ways that people can get a graduate degree in administration. One of them is they go to an MPH program and enter the management track of that program, and we currently do that. The second is they enter an MBA program and develop a health concentration. And the third, and historically the largest, used to be called a Master of Hospital Administration. Most of those, there's still a few around, but most of them, realizing the evolution from hospital to healthcare systems, have moved in the direction of Master of Health Administration degree, which is a degree that's not a part of a business degree, not a part of a public health degree, but focused on administration in its own right. There are only a couple of programs in Virginia. We're envisioning this as mostly a distance education program. A couple of maybe 1-week rotations on campus to do some face-to-face discussions, project work, and so on, but basically an online program. As I said, there are only 3 in, this would be the 3rd one in Virginia, so we are pretty confident that there's a market, and in particular, most of the existing programs are residential programs. We believe that the data show there's a pretty good market for people who want to be able to do this on their own schedule and do it online, and we think we can do that effectively, and that's what's described in the program. Basically, we think the program will grow from about 10 students a year to no larger than 20 students a year. It's a 2-year program, either 42 or 43 hours, depending on the track within the program. It will build on the expertise. It will require some new faculty over time as enrollment grows, but initially we're able to build on the management courses we have in the public health program, the management courses that we have in the Doctor of Health Science program, and the relevant courses in the Healthcare Delivery Science master's program. So where we can build on expertise and faculty capabilities that we already have, we're going to do that. And then the other three are graduate certificates of varying lengths, 3 to 7 credit hours. Art therapy, our degree is a combination degree, art therapy and counseling, so that all of our graduates can become licensed professional counselors. We did that a long time ago to increase their employability. There are both practicing licensed professional counselors in the community who would they don't want to take another master's degree, but they'd like to add art therapy components to their pool of expertise. Because this is a mental health program, they have been involved recently in working with the VA and developing programs for people with PTSD, and they entered into a contract with the City of Virginia Beach to provide counseling services for the trauma at the shooting at Virginia Beach. And so the sense is that there is a small audience. We're not looking to generate, these are not big revenue generators, maybe 20,000 a year or so, but we're looking at 3 programs, Advanced Cultural Humility. Obviously, there's a lot of discussion about topics related to that in the environment, and Trauma and Neuroscience Informed Art Psychotherapy, which would be for a counselor who's already a licensed professional counselor but wants to add art therapy as a tool. And then Trauma and Neuroscience Informed Therapy. So those 3 programs, again, between 3 and 7 graduate hours, we think maybe 3 to 5 students a year would be interested in that, mostly coming from the practice community who want to expand their skill set. So that's why it's not a full-fledged degree program. So I'm happy, Mr. Chairman, to answer any questions you have, but I bring these 4 programs to you for recommendation to the board.
Thank you, Dr. Combs. Any questions for Dr. Combs? So we have 1 degree program, 3 graduate certificate proposals for approval. That's the Master of Health Administration degree, Advanced Cultural Humility, Trauma and Neuroscience Informed Art Psychotherapy, Trauma and Neuroscience Informed Therapy certificates. No discussion, no questions. We will I'll call for a motion to approve.
Motion.
Second.
Second.
Thank you. It's been moved and seconded. So, Alonda, would you call out the roll call?
Yes, sir. Dr. Emory?
Yes.
Mr. Frame?
Some static.
Ms. Goodwyn?
Yes.
Dr. Husani?
Yes.
Mr. Hughes?
Yes.
Dr. Joffrey?
Yes.
Dr. Lindsay?
Yes.
Dr. Martin?
Yes.
Dr. Waldholtz?
Yes.
Okay. Thank you very much. So the degree program in Master of Health Administration and the 3 graduate certificates have been approved by our committee. Thank you. Thank you, Dr. Combs, for your report. Our last report is from the Vice Dean for Graduate Medical Education, Dr. Linda Archer. Dr. Archer.
Okay, thank you. A couple of things. Just wanted to announce all of our accreditation letters came in the spring. All of the programs that are accredited or have accreditation status are fully reaccredited by the Accreditation Council, and our podiatry residency was reaccredited through the Council on Podiatric Medical Education. Additionally, Eastern Virginia Medical School was given continued accreditation with commendations for compliance from the ACGME, so we did very well. We've had 3 residents test positive for COVID-19 over the past 6 weeks. We have about 36 residents in total that have been exposed and on quarantine, either through a patient exposure or, unfortunately, some of them get exposed from their co-residents. So we're developing a public service announcement on using your PPE, because we've lectured, we've said, please do this, and there's still people, including faculty, who are not using appropriate PPE. So we're doing a public service announcement, which will include Drs. Abu Hamid, Dr. Hooper from Centera, as well as other very visible people within the EVMS community. And we're also going to be doing a PSA on staying home when you're not well, because we've had residents come in with fevers who were one who was later diagnosed with COVID and ended up sending 3 faculty, 4 residents, and 2 techs home for 10 days. None of the others converted. But so we're really doing a big push. We formed a committee to look at pandemic response because our current emergency response policy really doesn't address pandemics, and across the country that's the case. So we formed a small committee with EVMS, CHKD, and also Centera to kind of look at what did we do right, what do we wish we had done, and what do we want to do in the future. So that's a committee of about 5 or 6 people. The only last thing I have to add is that we have been struggling heartily on the GME side about how to respond to the recent events surrounding George Floyd's death. We sent out a GME statement from the Diversity and Inclusion Committee, basically expressing solidarity with our communities and with our people of color. And we have also, that statement, as well as Dr. Homan's statement, will go to all of our incoming residents. And I just wanted to make sure, and we're still struggling about, I mean, it's nice to send a letter, but what are the things we can do? What are the behaviors we can change to hope that this current awareness, this current mindfulness stays, as opposed to, you know, it's here now and 6 months from now we've forgotten what's going on. So we're really struggling with that and trying to engage a number of people. Just want to make sure everybody knows that tomorrow afternoon at 1 p.m. Centera is holding a gesture of solidarity to recognize the brutalities and injustices that have been experienced. And that'll be at 1 p.m. and it'll be a moment of 8 minutes and 48 seconds of silent contemplation. So certainly everybody's invited to attend, but if you can't and you have the ability to, maybe at 1 o'clock you could take those 8 minutes and 48 seconds to join in solidarity with the people that are there. And that's the end of my report.
Thank you, Dr. Archer. Any questions for Dr. Archer? Dr. Archer, would you clarify again, how many residents have tested positive for COVID?
3.
3, right. Then there was 36 residents exposed in quarantine?
Yeah, approximately. Unfortunately, my remote access went down this morning and I couldn't access the numbers, but if I recall correctly, it's somewhere around 36. And only 3 of those came back positive. But anybody that's been exposed used to go out for 14 days. Now they have to go out for 10 days. They're tested and then they're allowed to come back from work. And that protocol is changing as that data and information comes back from CDC and other research venues. So that's a rough number. The 3 is solid, but the 36 is kind of an estimate.
So I have a question. Are we offering residents to get antibody tested? I know that it's not completely specific, but it's been quite enlightening. A number of people have had COVID and didn't know they had COVID. So I just am curious as to whether the residents will have the opportunity to be tested for the antibody.
Currently, I do not believe we're doing antibody testing, and Bill or Don, you can certainly correct me if that policy's changed since the last time I heard, but at this point, we're not doing antibody testing.
From the point of view of the task force that's bringing back everybody, faculty, staff, students, we had a lengthy discussion about that, and basically the advice and the literature are pretty clear that in terms of prevention, the most effective things to do are wearing masks and maintaining social distance and being rigorous about doing that, and of course hand washing and sanitation. The shortcomings of the antibody and antigen test, of course nobody knows about longevity.
Exactly.
And even they're really at a point in time, the same thing for the COVID test. And so our institutional posture has been, we're going to focus on if you come on our campus, you have to wear a mask and you have to maintain social distance. And then obviously it's in everybody's interest to regularly wash hands, and we'll provide breaks for that. And we got sanitizing solution everywhere. We've increased the number of sanitation rotations of the cleaning crew through all of our facilities, and that's where we are today.
I know a number of universities are trying to figure out how to bring students back on campus in the fall, and especially dormitories, which we don't have, although we have some housing, and what kind of testing they are or aren't going to do. It's been quite a conversation whether they're going to be doing antigen testing up front or what. And not that we expect that antibody testing indicates any sort of immunity. We don't know that, but it's just it's a difficult time because it's sort of a moving target.
Well, and it changes every day. If you saw the
as I say, a moving target.
Yeah, if you saw the news this morning, the studies were coming out that asymptomatic people weren't necessarily transmitting the virus.
Right. Which actually kind of makes sense because, I mean, we all know that we're exposed every year to different types of viruses, and some of us get them and some of us don't. And my husband had COVID, didn't know it, and I never got it. And my son and his girlfriend got it. So it's just, and the symptoms have been so wide and varied. But I read somewhere that it's only about 10, maybe in one study it said something like 10 to 15% of household contacts are getting it. So it's unusual. But maybe it's not unusual. We've never really looked at these sort of things in the past with other viruses.
Well, we're monitoring it closely. We are different, of course, because we don't have the dormitory issue that other universities have. But our policy at the moment is, as I stated, but we're looking at data coming in all the time. In terms of where we stand with students, just very quickly, the biggest influx of new students, where we'll bring in about 400 health profession students and 150 medical students, is in early August. And so we'll be monitoring what we're doing, obviously, up until they get here and after they're here.
Yeah, and I would also say, Dr. Combs and Dr. Archer, that I'm fairly certain that with new students coming in and new residents coming in, the concerns related to race relations and comorbidity would be included in their orientation.
Yes, absolutely.
Correct.
Great.
We are you reminded me that our policy for this incoming year is all the international medical graduates, anybody coming in from outside the United States, will go into 14 days quarantine prior to beginning their training program. We are not quarantining domestically trained people or people that have not left the United States. So it's only those international medical graduates coming in. And we've already advised them, and we are trying to build up a big brother, big sister kind of a relationship, so they've got somebody coming in that can help them navigate what it means to be self-isolated for 14 days when you're just in a new country and have to get your groceries and find a place to live and find places for your children. So it's going to be a challenge this year.
Yeah, agree. Well, thank you, Dr. Archer, for your report. And I want to thank everyone who gave a report today, quite informative. And I want to thank all of the Academic and Student Affairs Committee members who participated. Any old business before we close? New business? Okay, I think we're right at, yes, go ahead, Dr. Lindsay.
Dr. Martin, Dr. Lindsay, one thing had popped into my head about as we're approving some new programs, and I don't know if this is an easily answered question by the staff, of whether we are a yellow ribbon program for the VA.
I can't answer that.
Yeah, I can't either. What is the Yellow Ribbon program?
So it's for either Montgomery GI Bill or the post 9/11 bill, and basically specific schools have signed up to be these schools that accept funding from the VA. And I would certainly encourage anyone to just to look in to see if it's easy for us to do it, because it does attract some of these distance learners, post-military people, those kind of students. And if we're a yellow ribbon, it means that they're funded.
Okay. We'll follow up.
Yeah.
Thank you.
Mr. Chairman, I just wanted to add one point, chiming in to Dr. Archer's comments regarding the current situation and what kind of programming and activities that we we should be planning. You know, one of a few things that we have in plan is to have a virtual reflection board for the whole community, so that we are in the process of putting that together. And also we have a session planned with first with the SNMA students in order to actually help them digest and navigate through the pain and that they're going through first before reaching out to various groups and creating conversations to actually advance understanding and unity and solidarity. But really going forward, thinking about orientation as an important place as well to engage students and to go forward with planning our curriculum as well. That is one piece that we're really trying to integrate in the curriculum. That we know racism and so on in our QEP plan as well. Those are some of the things that we want to deepen the conversation on.
Thank you, Dr. for that update and for the excellent work with community involvement. So we
Mr.
are.
Chairman, we just got a note. We are, in fact, a yellow ribbon school.
Good.
Great. Okay, so that could be further follow up with that, and if that information can be forwarded on to all the committee members, that would be great. So we're at the 10:50 mark, and we're now, it's time for us to adjourn. Again, I thank you all for your participation today, and have a great rest of the day. Bye-bye.
Thank you.
Thank you all.
Take care.
Bye-bye.
Thank you.
Thank you.
Bye.
Alan Wagner, is he come, and Richard Litton, is that correct?
No, who are we missing? I know Chester Hart was unavailable. I don't have Sharon Goodwyn.
Sharon Goodwyn.
And then is Mark Warden coming?
Are we on quorum?
He was on this morning for governance, so I expect he'll be in. Hello, Mark.
Okay. Okay.
We're a minute from liftoff anyway. We're okay.
There's three though. We have Sarah. We have Robert Bianchi. We have Dr. Damon. Who's on a minute ago.
How come we can't see everybody that's on?
Adam, can you toggle to?
Give you 9, like the way that Blue Jeans has it, I can give you 9. Pretty much you.
Okay. Okay, that's helpful.
Oh, it's good.
Is it possible to get the sidebar that shows us who's logged in, at least?
Not on that screen, no.
Okay.
Well, either way, just so we can see.
Ask Adam and he can probably see it.
Yeah, Dr. Martin. So you mean there could be more that are not showing up
Yes.
here?
So
13.
Ask Adam who you need and he can see if somebody's logged on.
Is there a way to see who is logged on?
I have it here I'm moderating in my window. I can list.
Maybe we could.
So tell him names and he can confirm. Or...
Yeah. So who?
I can see Dr. Marcus Martin on my screen, who's joining in his soon to be announced role, which we welcome.
Yes. Thank you.
I think we're good. We have.
And we may have Dr. Emory, Teresa Emory joining us in her eventual new role.
No idea.
We'll announce today.
Oh, just up there.
Not as well. I mean, he's in.
Okay.
Well, right. Yeah, sorry.
Casey, we're good in broadcasting.
Okay, we are broadcasting. Sarah, if you would like to start.
All right. Good morning. I thank all of you for attending, and I believe I know we've got Dr. Marcus Martin joining us, and I believe we will have Dr. Teresa Emory joining us. We welcome them around the table with us. So good morning.
Thank you. Good morning.
We are, of course, meeting by electronic means today as permitted by Virginia law during the state of emergency as declared by the governor due to COVID-19. This meeting will be held entirely in open session and is being live streamed and recorded. All votes that are taken today will be done by roll call. And so you'll hear us call to Heidi to walk us through that. So our first order of business, the approval of the minutes for March 10th. Are there any corrections, changes, additions to those minutes? I'm looking for hands or listening for a voice. Hearing none, I need a motion to approve the minutes.
I'll move the approval.
A second, I'll take that, Admiral. Saw your hand go up. All those in favor of approval of March 10 minutes, please say aye.
Aye.
Roll call?
We have to do a roll
Anyone opposed? Heidi, you got to go through it. I'm sorry.
Yeah,
Ms. Bishop, Chair Bishop, we actually need you to do a roll call vote, please.
Yes, Heidi, go right ahead.
All right, Miss Bishop,
Yes?
Admiral Bianchi,
Yes.
Dr. Damon,
Yes.
Miss Goodwyn,
Yes.
Mr. Lewis,
Yes.
Mr. Warden.
Yes.
That's all.
All right, thank you. So our minutes stand as approved. Next item on the agenda is the report from our external auditors. We welcome Nick Strong and Trey Oglesby. They are here with us. Go ahead, Trey and Nick.
Well, thank you for having us here today. Excuse me. Hopefully everyone can hear me.
Yes.
Okay, perfect. So thanks for having us here today. Generally in the audit process, this is a status update for us. So, if you think about where we are in the process, we're between our interim field work as well as our final field work. So we'll come back later this summer execute our final field work and be prepared to present the results of our audit at the meeting that is typically in the October timeframe. That being said, as far as a verbal update, at this point in the audit process, we've, like I said, completed our interim procedures. That included both walkthroughs, so we'll take a process from soup to nuts. So initiation or acceptance of for example, in the tuition process, acceptance of a particular student all the way through when they register and when they've paid for their specific semester. And we do that across every single process. I would also highlight that we normally bring up any changes to our planned audit approach. I would say there are no changes to our planned audit approach. However, I would bring to your attention that previously, as communicated in our audit planning meeting, EVMS was required to adopt ASU Topic 606, which is the revenue recognition standard. Between that time and now, the FASB actually initially approved a delay of that standard, the adoption of that standard, only for franchisor accounting organizations. So think about your McDonald's, Burger King, anything that's a franchise. However, because of feedback from the broader not-for-profit as well as other non-public entities, they've elected to delay that standard for entities such as EVMS as well. So it won't be applicable for you until July 1st, 2021. So that'll be kind of pulled back from an agenda item, both from management, although we already started working through it with management. Nothing that, I would say is wasted time, but I think it's prudent to, give ourselves or give you another, call it, 13 to 15 months to digest the standard even further. In no sense, when you think about COVID and how we're interacting now, layering in another complex standard to adopt during this time where things are largely remote, I think is prudent to kind of hold off on adopting. So that kind of concludes our commentary. Again, it's just a verbal update. I welcome any questions or comments from either the committee or management.
Any questions for Trey or Nick? All right, well, thank you for the update on that standard. And so the new committee coming up in our new year, we'll look to see that instituted July 21. Thank you.
Yes, ma'am.
Wonderful. Thank you so much, guys. All right, Barrett Wood with our internal audit update. And we have 3 risk-based and I think 4. So Barrett, why don't you
Yes, ma'am.
that?
Can you hear me okay?
Absolutely.
Okay. Yeah, if you click on the link for the update, under the 1.2 for the risk-based audits, we've moved into the reporting phase for the facilities management audit, the fiscal 19 audit. That's ongoing. The fiscal year 20 audits, the new academic program development process audit, we've deferred that. Due to the virus, the SACS accreditation process was deferred, and that involves some review of academic programs. So we think it was best to defer that audit until after that SACS review is finalized, and that's in February of 21. So we'll take it up at that point. The respirator use clearance process audit was completed. That report was issued. There were some low findings associated with that audit, and corrective action on those is in progress. Student financial aid. The field work for that, due to the virus again, has been pushed off to the November-December timeframe. So we will be starting in November. We're typically doing an interim audit right now, or wrapping that up actually. So we'll be doing that towards the end of the year, which also means we'll probably be doing 2 compliance audits during fiscal 21. Under the annual audits 1.3, the Virginia Postal 9/11 audit was completed. Again, some low rated findings there. Those corrective actions are also in progress. Petty cash, obviously that has not changed since the March meeting. We need to be in person to do those audits. Hopefully that can be wrapped up in June, but there may be some delay with that as far as getting hold of people. And then since the March meeting, we had a new special project that was requested by institutional compliance. That involved a specific employee and alleged misappropriation of assets. If anything, there may be a few questionable expenses there, but we're still needing some information from a furloughed faculty member. So we're kind of on hold with that one right now. And that's all I have unless anybody has any questions.
Any questions for Barrett or any concerns about the delay in the risk-based audit? Typically, I think from what it sounds like, the area of the academic programming, student financial aid. Any questions on our internal audit? All right. Thank you very much, Barrett.
You're welcome.
Stacy, the compliance report.
Hey, hello everyone. I'll give a quick update on our annual compliance training for faculty and staff. We did push off the date that everybody had to complete the training because the wrap-up was originally due April 15th. We are now asking everyone to have completed modules by July 1st. We had about 53% completion for faculty and about 67% for staff. It's actually higher than that. Some people have to go back and finish certain modules. So that is in progress. We've also started what we're calling our ramp-up training, and that's training that's all being done by the ramp-up task force being created, led by Don Combs. It's a COVID screening questionnaire, training on social distancing, masks, hand hygiene, self-monitoring for illness, and a certification to abide by requirements. That's being completed by all employees, depending upon the departments as they come back on campus, and also our students. When they're going through that process, we're reminding them to complete their annual training as well. Today we have 6 policies for approval. I'll go through each one, and we have 5 policies for deletion. The deletion policies come up because we combined a lot of it into one policy, and those policies are obsolete, but we need approval on both of those things. We have the policy development policy, which is a revision to allow for delegated authority for certain academic committees to approve policies related to students in their program. These are not board level policies, they're program specific, and this has really come about because of our revision to policies for LCME. So they're policies that are specific to the MD program. So that delegates the authority to committees, the medical education committee and the missions committee of the medical school. All policies will still come through my office for assistance with policies to make sure they're in compliance with EVMS standards. Second policy is a diversity policy. This is Office of the President policy. We're asking for reaffirmation of this, so a new approval. This hasn't been looked at in a while, so this was reviewed by our Vice President for Diversity and Inclusion, Mr. Gamata, who indicated that the narrative and diversity statement continues to be aligned with our strategic plan. Again, for our reaccreditation, we wanted a new look at this at the board level, a new approval. Asset naming policy, this is a Office of Development policy. We had terms in the old one, established assets and non-established assets, and that's brought more in line with what other schools have done. They removed those 2 definitions, so it really goes with the board approves namings for $1 million and over, which that was already built into our policy. You'll see at the board today, there is a list of assets that will be approved for naming. Authorized drivers policy. This is the policy that brought the need for some of the deletion. This is kind of a revision that was done. So this is a new policy to ensure that all individuals whose job descriptions require driving go through risk management, fleet, and driver safety training program. It's training, providing driver's license information, insurance, et cetera, to confirm. So that's a new policy. Non-discrimination and anti-harassment policy. This is a new policy, Office of the President policy, We had multiple statements of non-discrimination and anti-harassment in various places throughout the school, with human resources, with students. This is an overarching policy for the school, consolidating the non-discrimination and harassment statements under one overarching policy. Communicable disease policy, this is a revision. It incorporates the requirements to follow EVMS directives such as masking when approved by the Academic Occupational Health and Safety Committee. That's the institutional committee that's responsible for occupational health and safety. And then there are 5 policies for deletion listed there: authorized driver policy, vehicle use policy, reported vehicle accidents policy, lease car policy, and DMV authorization policy. Again, all requesting deletion because they are being in the new authorized drivers policy. I'll take any questions on individual policies that anybody has.
This is Sharon Goodwyn. I had a question on the asset naming policy. I noticed there was something added that in order for us to name something after a faculty member, they have to be deceased or retired. I thought we had considered doing something to honor Dr. Britt. Do we have any concerns with initiatives on the horizon and adding that to this policy?
I thought there was an exception clause, right?
Okay.
Talked about that. Because you're right.
Yeah, it's retired or deceased. I know you guys discussed. This is from development. I'm looking to Grant or Dr. Homan have these discussions.
I know it's been accounted for, but I don't know exactly where it is in this. So let me look real quick.
I thought there was an exception clause that required my approval to be able to. I recall seeing that from Connie. I don't know if it made it to your policy.
It's not in here, so.
Not.
If not, I say that we strike that line from here, so that seems we're at question. That in order for EVMS faculty or staff to be considered for such a naming, he or she must be retired from EVMS or be deceased unless approval from the president.
Yeah, there should be an exception. Yep.
Yep.
I'll add unless otherwise approved by the president. Any other questions? We will consider that policy to have that clarification in it, the extra words.
Any questions, or thank you, Sharon, on that, by the way. Any questions or concerns on any of the policies? I think we're okay, Stacy, in doing them all at one time.
Yeah, you can take the policies for approval and for deletion all as one vote, and we'll do it by roll call.
And so it's for the 6 policies with the one on asset naming with the change, unless altered, unless approved by the president, so we don't have to knock off somebody to honor them, and the removal of the 5 policies that have been made obsolete. Our bylaws require the board to vote to delete a policy. So we have the 6, the altered one, noting the altered on the asset naming, and the removal of the 5. Heidi, you want to take us through the roll call?
Motion. Can we get a motion, please?
Thank you. Is there a motion to approve the alt? Second?
Second.
Second. All right.
Okay, Ms. Bishop,
Yes.
Admiral Bianchi,
Yes.
Dr. Damon,
Yes.
Ms. Goodwyn,
Yes.
Mr. Lewis,
Yes.
Mr. Warden. He was muted.
Muted.
Okay, yes. Can you hear me now?
Thank you. Thank you.
Okay, sorry about that.
That's everyone.
Great. Well, the policies stand and the removal stand. So thank you very much. Is there anything else to come before the audit and compliance? Questions for Dr. Homan or staff? Any issues or concerns? Hearing none, is there a motion to adjourn?
So moved.
Is there a second? Do I need that? If not, the meeting is adjourned.
Thank
All right.
you.
Thank you.
Thanks,
For all the
everyone.
setup.
Thanks, everyone.
Nice setup.
Finance Committee at noon.
Wonderful.
All right.
Thank you very much, guys.
Bye. Bye.
Bye-bye.
Good morning from EVMS. Please stand by. This meeting will start momentarily.
Got it.
We canceled at 4 p.m. today, just to let you
Thank you for that.
know. I thank myself for that too. 'Cause I'm running out of food. I gotta pick up dry clean. Did Ross get you the information on the?
Mr. Warden, we're ready whenever you are.
Well, I'm ready, and but I'll defer to the chair, Mr. Bianchi.
Sorry, Admiral.
Yeah, that's okay. Thanks. So I don't see. Somebody had mentioned earlier. I think Chet's not available today, right?
That's right.
Okay. What about Alan? Do we know?
He was supposed to.
He was
Okay.
not in audit compliance.
How about Tina?
He stated she would be on, as did Mr. Litton.
Okay. Well, I'm willing to wait a minute or two here. Well, it's 11:55 and just turned noon. Well, yeah, we do have a lot to get through, and I know we want to finish a little bit before so that folks can, we don't hold up the 1 o'clock session. So maybe we should go ahead and call the order at this point. Linda, we do have a quorum?
Yes, we do.
Okay. All right. Well, then, good afternoon now, everybody, and welcome to the Finance Committee session here. We'll call the meeting to order. And much like those of you that were sitting through prior sessions this morning, we are meeting by electronic means today as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held entirely in open session and is being live streamed and recorded. All votes that we take today will be done by roll call. Okay. And I like to welcome Dr. Martin is joining us today, and I saw Mark on there as well. So welcome.
Thank you.
All right, so we've got a fair amount of business to get through today. A lot of it we had talked about at our prior session on 19 May. There's been 1 or 2 minor changes since we last met, and Helen will go through that. But the first order of business at this point will be to approve the minutes of the meeting, the special meeting we did have on. So if I can have a motion to approve the minutes.
So moved.
Okay, and second? Second. Okay, roll call.
Admiral Bianchi,
Yes.
Sarah Bishop,
Yes.
Dr. Julie Damon,
Yes.
Mr. Chet Hart, Mr. Ashton Lewis,
Yes.
Mr. Richard Litton, Mrs. Tina Moore, Dr. Alan Wagner, Mr. Mark Warden.
Yes. Okay, thank you. Stand approved. All right, so just to give you a heads up for today's session, we will be having 2 votes during the session today. We'll be voting on the 21 budget, and then we will also be voting on the state indigent care apportionment plan, both of which Helen will walk us through here momentarily, but just wanted you to know that those are the major pieces of business that we need to get through during today's meeting. To start, however, I would like to ask Helen to give us an update on our finances up through April. And then once we finish that, we'll roll right into the FY21 budget package. So Helen, if you would, please.
Okay, thank you. So I'm going to share my screen and show a couple of the schedules that were provided to everybody in Diligent. I just feel like if I can show you the schedules that I'm talking about, it might facilitate the presentation. So you bear with me. I'm going to switch over. Can everybody see that?
There we go.
Hey, it's Alan Wagner. I'm having trouble logging in. It was working before, but I'm not getting this one to work. It says
Okay.
URL not found.
We
URL
can hear
not found.
you, Alan.
Yeah, I called in, Bob. So
Okay.
I can hear.
Got
I'll
it.
figure it out. How you doing?
Okay, so in the packages in the diligent, we did have the results through April 30th, 2020. As I indicated at the last meeting on May 19th, we were having a very positive year before COVID-19 hit, which will fortunately help us sustain the financial implications of COVID. This schedule reports the statement of activities by mission through April 30th. If everybody, if they're not talking, can mute there. I'm getting some feedbacks. Okay, thank you. So this is the statement of activities by mission. It includes all of the missions of the medical school and the various net access. So as you can see, through April 30th, we have a $17.3 million bottom line. We just began seeing the impact of COVID starting in April. And we can see this in the core operations. You can see my cursor, the actual month of April, we posted a loss of a little over $100,000. This is mostly due to the impact from the clinical operations. Their margin is distributed 70% to additional clinical compensation for their faculty and 20% to core and 10% to department reserves. And so we saw a decline due to their decrease in their margin due to COVID-19. We also had some additional expenses, approximately over $500,000 posted in April due to PPE and additional housekeeping expenses that were incurred due to COVID. Some other areas where we're starting to see some impact includes the foundation support. The annual fund usually starts ramping up about this time, but the philanthropic support for the annual fund has seen some impact, as well as some parking revenue for visitors that are coming into the EVMS campus, to the various hospitals, as well as to our clinics, due to patients, to the patient visits being stopped. And then also in some of our other sources of revenue, we have professional skills revenue that we provide to outside sources, which they were no longer able to provide that service due to COVID. As well as, here's the operations from the clinical enterprise. Again, if you can see my cursor, the actual for the month is about $915,000 loss. This is due to the patient visits being restricted and not allowing to not have non-essential visits. So we had to cancel patient visits, which impacted the clinical care and the patient revenue. So our core bottom line through April is $4.3 million. This is consistent with what we had been reporting for the entire year, where we were having a very strong year. It is mostly made up of the salary and benefit savings from vacant positions. This is offset by decreased tuition and fee revenue due to the health professions programs and the decreased enrollment in health professions programs. Again, we're starting to see some of the COVID impact. Here's the standardized patient revenue, some of the annual fund support, and then the additional expenses related to COVID-19. The clinical enterprise, they were having a very good year. They had implemented some new standards and some new processes during the fiscal year, and so they were projecting to have a very strong fiscal year before COVID. So this will help them to be able to hopefully sustain a positive margin through the end of the year, even though they will be encountering significant losses due to COVID. But I did want to point out, even though that they have had almost $1 million loss just through April, they are projecting to be better than, they are currently better than budget. They are also significantly higher than where they were last year. So although we have seen negative impact, there are still some positive trends in the clinical operations. And I just wanted to point out that we have met our bond covenants. Our net assets to long-term debt and our debt service coverage ratio are significantly higher than what is required for our bond covenants. And we do project that we will be meeting our bond covenants by the end of the year.
And that's always a good thing.
Yes, that's key.
Okay.
So unless there's any questions, I will jump right into the budget presentation.
Any questions from anyone? Okay.
A quick question, excuse me.
Yeah,
Can
that's
we just get is Kurt there with the EVMS medical group?
Yes, I'm here.
Can you provide a summary, just a brief summary of what were made that led to the positive financial status?
Sure.
Has that been in the making years and finally bearing fruit, or are they new changes?
There's a couple things. To go back just a couple months, as Helen stated, we were projecting a very strong end of year, upwards of $8 million net excess. Then COVID hit and we had to start adjusting. I'll tell you the bottom line and I'll go back and tell you the story behind it. We're this month, year to date, we're still at a net excess of 5.2 million, and we're projecting about a 5.3 when it's all said and done. And to give you the background here is when COVID hit, our volumes dropped off dramatically. Not only did the volumes drop off, we had to re-engineer how we delivered medicine, as patients were not coming in for face-to-face visits. In a very short period of time, we had to stand up telemedicine, which we were not well prepared at the time that the pandemic hit. So we were fairly successful in setting that up, and we have been deploying that out. We also started implementing what we call, and our volumes dropped pretty drastically. So for example, in April, we were more than 40% below our average run rate for the year. Today, as of May, we're only down about 28 to 29%, mostly because of the ORs have been closed. That drives most of our revenue. As those start to open up, we'll see our revenue start to ramp up. Telemedicine, the regulations were changing on a daily basis, whereas before they paid about a third of the face-to-face rate. By the end of a couple weeks, all the payers had aligned with Medicare and Medicaid, and they started paying the full amount for not only telehealth, but also just a phone visit. So we had to re-engineer. At the same time, we were distancing, so we were pushing employees out, limiting the number of people in spaces. We had to learn to work from home. So a lot of our processes were not home-based, telework type workflows. So we had to re-engineer all of our workflows in our business office, our business collections, and also, redefining how we provided care in the clinics. We put together a plan. We called it the sustainability plan, and it focused on volume, getting back to the reasonable amount of volume. And then once we started having lifting of the restrictions, we had a ramp up plan. We called it Volume Plus. And we also had a pretty intensive review of how to reduce expenses, putting people out, having them use their vacation time, accrued sick time if they had symptoms. That Volume Plus and cost reduction, I think, is really what's gotten us here today. We also benefit from receiving some funds through the Medicare payment CARES Act, the Health and Human Services grants. We received 2 grants. And then we also received a PPS, or PPP loan. And we're in the process of making sure that we audit that to make sure we determine whether we can convert that into a grant or to what extent we have to repay that. So I think and I would say that the loan amounts have not been calculated into our projections here. And then just recently, we received some funds from the PSPP funding, which pays us based on our Medicaid volume. And because of COVID, they changed the formula that benefited us. So we received an unexpected increase in our PSPP dollars. That really has helped our last quarter. Happy to answer any further questions.
Thank you.
Thanks, Kirk.
Just to-
And, I know you're going to give us an update here in a little bit as well, so I'm sure that was probably part of.
That was most of it, but I'll be happy
Yeah, there
to
we
go
go.
over.
Well, good.
If I may just clarify, the PSPP is a physician supplemental payment program, which is the upper payment limit program that I helped to develop 7 years ago, and that's bumped up from a calculation through Medicaid and the feds, and we're the beneficiaries of that. So that provides supplemental payments that go back to the practice plan. That's all. I just wanted to make sure that you knew the alphabet soup. Essentially, that's the UPL funding that I was helped to develop years ago, and that bumped up unexpectedly because of the COVID issue, and I suspect as well by virtue of the fact that Medicaid's been expanded.
Got it. Thanks, Rick. Okay, thanks for that update. And go ahead, Helen. Why don't we then shift into a discussion of our FY21 budget?
Okay. All right, so this presentation was provided in your diligent, but okay, so since our meeting, we went over in detail the budget on May 19th. We did have one change to the budget. It was a more of a reporting change, and it was an adjustment to both our revenues and expenses for interdivisional eliminations. This is where we're required to eliminate any revenues or expenses that are intercompany and shouldn't be included in the total of all of your activities. So this is a change to both revenues and expenses, and it went from a credit of 3.6 million to a credit of 4.7 million. So it just had an impact on the total revenues, but no economic impact or no bottom line effect. So given in this environment that was our only change, we were very pleased that we didn't have to make any additional modifications to the budget. So just to remind everybody, this was discussed at the last meeting, but the core budget includes a break-even core budget. It does have almost $880,000 of institutional one-time funds that can be used at the discretion of the president for things that come up during the year. We also have a small contingency reserve, as we have had in prior years. The tuition increases budgeted for next year are consistent with what we have had for the last number of years. So the MD tuition in-state increase is 2% and the out-of-state is 0%. We have not had a out-of-state increase for at least 7 years. The health professions increases are going to be 2% in-state and 4% of out-of-state for most of the programs. The tuition includes an additional $200,000 reserve. This was incorporated due to potential changes due to COVID, also based on the history that we had this year with the health professions program. Our state appropriation, there's no change from fiscal year 20. I did want to remind everybody that we had in our projections where we were trying to get operation and maintenance funding for Waitzer Hall, and we had included in our long-range projections $1 million, which was never funded. We did get Through the General Assembly, $625,000 of additional support for base adequacy, but the state had to rescind this due to their economic impact due to COVID and the reduced revenues that they are projecting for their fiscal year. So they had to rescind all new spending and all new initiatives on their budget. So that with all the uncertainty at the state and their economic position, we are monitoring closely what the future for the state appropriation has, and that currently remains uncertain. The facilities administrative cost recoveries, we had a decrease of $1.1 million, and this is mostly due to Conrad. This reduction was expected as their funding, some of their large awards are sunsetting. They do have 2 large submissions in progress, and we have not budgeted those new awards. So this is assuming that no new awards are received in fiscal year 20. The same is true with all the other grants that we have, the non-Conrad grants. We haven't budgeted any new awards. So we have a slight decrease of $60,000 in F&A in those areas. We did put in a reduction of 246 due to COVID. Given that we don't know how quickly we'll be able to ramp up research, we thought it was prudent to incorporate a slight reduction in our budget. The clinical 20% support, this is again the 20% of the clinical margin that is provided to EVMS into our core budget. The fiscal year budget for next year is $1.8 million. The projected actual before COVID was $1.7 million, but the projected actual due to COVID after incorporating $1 million estimated reduction, the adjusted projected actual is $700,000. That was better than budgeted. The fiscal year 20 budget was $1.3 million. As reported, we have suspended employee raises for next year. We did have a health insurance. The originally proposed rate increase was 10%. But we limited that increase to 7.5% by using fundings from accumulated health insurance reserves. So we're projecting to use $1.2 million out of our $9 million reserve. Again, we felt this was important in the year that we were not providing raises to employees to try to limit the health insurance increases as much as possible. The GME program is a 3% resident stipend increase, and this is funded by our affiliated hospitals. The 3% increase was required to remain competitive in the residents in their salary environment. So this is the only area where we're providing increases to salaries. The resident FTEs increased from 353 actual in fiscal year 20 to 374 that is budgeted in fiscal year 21. The clinical operating margin, their fiscal year 21 budget is $13.1 million. This does include $4 million of the UPL or PSPP revenue that goes directly to department reserves that we just talked about a few minutes ago. The projected actual for pre-COVID between the medical group and EVMS pediatrics was $13.2 million. The adjusted projected actual is $8.5 million, which is a $4.7 million reduction due to COVID-19. And then the fiscal year 20 budget was $8 million. So again, we are projecting them to be better than budgeted even after COVID. Sponsored research has a budgeted decrease. This is mostly due to the Conrad program. And again, this reduction was expected, and it does not include any new awards. And then the all other awards, the non-Conrad funding is a slight reduction, but again, no new awards are budgeted. Then department reserves, we have a slight net excess. Through March 2020, the balance of the department reserves was $60 million, but these funds are already committed. They include chairs funds, student fees, the insurance reserves that we're using for next year's health insurance, et cetera. And then the EVMS reserves, we are projecting to use some EVMS reserves next year. But even with that, we are expecting to have a reduction of $3.1 million and have an ending balance next year of $46.3 million. Those reserves are important. There are things that help sustain us during a crisis like COVID, but they're also necessary for the recruitment of talent and chairs and faculty to the institution. And that concludes my report, unless there's any questions.
Okay, any questions from the team here? I know we walked through this in fairly great detail during the May sessions. All right, if there are no questions, then if we could have a motion to approve the budget as presented.
So moved.
Second?
Second, okay. Linda, if we could take roll.
Admiral Bianchi,
Yes.
Sarah Bishop,
Yes.
Julie Damon,
Yes.
Chester Hart, Ashton Lewis,
Yes.
Richard Litton,
Yes.
Tina Moore, Alan Wagner,
Yes.
Mark Warden.
Yes.
Okay, thank you. So the next order of business is a review of the state indigent care apportionment plan. This has to be revisited, help me out, Helen, every 2 years, I think. Is that the deal?
Yes.
Yes. And so we're coming up on that time frame here. So hopefully you had a chance to glance over it in the board books, but Helen will give us a quick overview, and then this is another document that will require a vote by the committee. So Helen, if you would address that.
Certainly. So included in your diligent package was the state indigent care apportionment plan. Out of the $30.4 million we received from the Commonwealth of Virginia, $6.2 million is designated to support indigent patients in Virginia. And so EVMS receives those funds, and we distribute those to our affiliated hospitals as well as our practice plans. And this document outlines how that is distributed and what kind of monitoring we do. You might recall the internal audit reports. They audit this program annually, and so that's part of the documentation in this plan. So we are required to present this and get this approved annually, and so we're submitting it to the board for approval. And I just wanted to note too, there are no changes. This is the same plan that we've had in place for at least 20 years.
Okay. Any questions or discussion on the plan? Okay, hearing none. Then I would ask for a motion for approval.
So moved.
Okay, second.
Second.
Okay, thanks, Julie. All right, Linda, if we could take roll.
Admiral Bianchi,
Yes.
Sarah Bishop,
Yes.
Julie Damon,
Yes.
Chester Hart, Ashton Lewis, Richard Litton,
Yes.
Tina Moore, Alan Wagner,
Yes.
Mark Warden.
Yes.
Okay, thank you. All right, so next we have Kurt. I don't know if you'd like to add any additional items there. I thought you gave Sarah a really great recap of your current position, but if there's any other items you'd like to share with the committee, the floor is yours.
Not much more to add other than just really proud of the team pulling together, and also Dr. Bumgarten for helping us make our clinic safe and standing up the drive-through clinic. And as we come back to work, we're just making sure that everyone is universal masking, and we want to make sure we ramp back up in a very safe way. That's all I have to add. Happy to entertain any questions you might have.
Sarah Bishop here. Kurt, are the savings that you had in the clinical enterprises, are those one-time deals, or should we expect to see those savings continue? I know sometimes budgets look good because you cut back savings, but at some point, on supplies, you've got to reorder. Is that one time or is it sustainable?
I think that prior to COVID, our run rate was really true performance. And after COVID, I believe we'll get back to that level of performance. And that is being achieved by, looking at each department, looking at the expenses, becoming more efficient, making sure that our practices schedules are optimized. So looking at the appropriate level of patients we should be seeing on a hourly basis, daily basis, monthly basis. So I would say a lot of it was related to same store growth. I hope that answers your question. It's not a one-time. I think it's core operational changes.
Thank you.
Okay, well, thank you, Kurt. And I think you guys very admirable how you were able to pivot quickly and respond to the COVID environment there and adjust and adapt. So looks like you guys are heading in a very good direction here. So thank you. All right. At this point, the floor is open if there's any new business. I don't have any, but if any of the committee members would like to place anything into discussion at this point.
Admiral, I've got a question. This is Sarah Bishop it's probably for Dr. Homan. The money, the 625 that was rescinded by the state of Virginia, did that happen to everybody? Have we been singled out? Is that throughout the state?
I'm not aware of what other institutions had. I just am aware that the COVID-19 loss in income tax revenue and revenues to the state has pared back our requests. So I suspect many other institutions also had similar requests rescinded as well. So as a result, essentially, our base adequacy is flat and there will be no increase in that. And then we still have to wait until after the General Assembly meets in August to determine whether there will be any other adjustments to the state budget, which may create a need for a further cut in our budget because it depends on the financial status of the state. Still an open question, do not know.
Thank you.
Okay. Any other comments, questions? All right, hearing none, then we will move to adjourn the meeting. I will let you know that you will hear another budget presentation during the full committee meeting here. So you're going to get to know this budget really well as part
All right.
Yes. So you'll be the experts for the rest of the full board there. You guys will be the pros from Dover here. But yeah, so we will vote on the budget and we will vote on the apportionment plan as well in the full budget meeting with the recommendation from the Finance Committee. Okay. All right. That being said, then I move to adjourn the meeting. So
Good.
Are adjourned.
Thank you.
Thank you very, very much for all of your support here through the budget process.
Good afternoon from EVMS. Please stand by. This meeting will start momentarily.
We're going to get the live stream teed up, so just be aware that you may be broadcast. We'll let you know when we're clear and ready to start.
Thank you.
Mr. Warden, I think we're ready to go.
Okay, great. And it looks like we have 16 people dialed in on Blue Jeans. I assume that's enough for a quorum.
Do we have 16? We're just not seeing their faces.
Tracy, if you have questions as to who's logged in, you can ask Adam and he can tell you what names are on.
Okay, so here's who I'm missing. Hugh Cleese?
He's there.
I'm here.
Bianchi? Okay, great. Bianchi?
He's there.
Is Mr. Frame here?
No.
Okay, Mr. Lewis?
Here.
Okay, thank you. Dr. Lindsay? Okay, Mr. Litton?
Mr. Litton has a conflict at 1 and will be dialing in later.
Okay, and Dr. Wagner? Dr. Wagner? No?
Not yet.
Okay.
With us last week.
All right, are we confirming that we have a quorum?
Stacy? That gives us 12 out of 17.
Tracy, Dr.
Okay, we have 13 out of 17. Okay, we have a quorum. We have 13 right now out of 17.
Great. Okay. Well, on that note, we will officially start the meeting. Good afternoon, everyone. This is new. This is our first board meeting over Blue Jeans. So, we'll kind of, I think we've all had a little bit of experience with our committee meetings, so hopefully this will go as smooth as those. We do have a full agenda today. Let me start off by reading the following. We are meeting by electronic means today as permitted by Virginia law during the state of emergency declared by the governor due to COVID-19. This meeting will be held in both open and closed session. The open session is being live streamed and recorded. Following a motion and vote of the Board of Visitors to convene in session, members of the board and EVMS personnel will leave the open session and proceed in closed session. Following the closed session, the Board of Visitors will return to open session to certify that only public business matters lawfully exempted from open meeting requirements and which were identified in the motion authorizing the closed session were heard, discussed, or considered in closed session. And then all votes taken today will be done by roll call vote. Okay, so it might take a little bit more time than normal to get through the voting. So these are certainly have been some unusual times. First, we had the pandemic, and sort of we all know what's been going on with that. Then we had the situation coming out of Minneapolis, and then just kind of what's been going on around the country as a result of that. So we thought it'd be a good idea to take a moment for a little self-reflection before we start our meeting based on those factors. So just if you join me for just a moment. All right, thank you. All right, so our first order of business is the approval of the minutes. Hopefully everyone has had an opportunity to review those. Are there any changes or questions on the minutes? All right, hearing and seeing none, is there a motion to approve?
Move.
Is there a second? Approval. Thank you. So now we must do a roll call vote.
Okay, Mr. Hughley?
Aye.
Rear Admiral Bianchi?
Yes.
Ms. Bishop?
Yes.
Dr. Damon?
Yes.
Dr. Emory?
Yes.
Ms. Goodwyn?
Yes.
Mr. Lewis?
Yes.
Dr. Waldholtz?
Yes.
Dr. Lindsay? Nope, he hasn't joined us yet. Okay, Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Warden?
Yes.
Ms. Moore?
Yes.
Dr. Joffrey?
Yes.
Okay.
Okay, thank you. So our next item on the agenda is the report of the president and provost. Dr. Homan?
Thank you, Rector. If you see your agenda on your diligent books, I'd first ask you to go through the 4 areas that we need for approval. I'll walk through each one. The initial appointments and promotions recommended by the provost and dean. These are the full-time non-salaried, salaried faculty members, community faculty members that were recommended by the Appointments and Promotions Committee to me, that in turn needs to have approval from the Board of Visitors for their approval. What I'd ask is, I've talked to the rector about this, is we hold a vote perhaps, unless there are any specific questions, in aggregate for all of the different action items. So are there any questions first related to the recommendations for those individuals for appointments? This is routine. Okay, hearing none. The next is a recommendation for tenure. If you click on that, it's for Dr. Woo-Kee Kim, who is one of our outstanding researchers that we've been able to maintain and retain here at EVMS. He's been offered other positions at other institutions. He has 2 grants, national grants. He's nationally renowned in the area of inflammation, neuroscience, and is involved in Alzheimer's research and HIV research. I won't go through all of his CV, as you have that in your packet, but I recently appointed him as a senior associate dean for research on the basic science side, and he's also a member of the newly created Center for Integrative Degenerative Disease that we created too within the basic sciences. He has an outstanding reputation educationally, and as well as his research portfolio, which you can go through. He serves on many professional memberships, scientific committees, educational committees here at EVMS, and he's been on our faculty since 2007, did his postdoctoral training at Harvard, and received his PhD in New Jersey. So any questions related to his recommendation, who went through the process for tenure, and now we're recommending his approval by this body. Okay, the next is the recommendation then for Dr. Lauren Mazurko for the Rosemary.
Dr. Homan, this is Paul Frame. I just
Yes,
wanted
Paul.
to say I joined the meeting a few minutes ago.
Very good. Thank you
Thank
for joining
you.
us, Mayor.
Thank you. Okay.
The next is a recommendation for Lauren Mazurko, who's the Rosemary Fenton proposed and Garnet Jordan professor in geriatrics. You have her CV before you as well. Dr. Mazurko is one of the up-and-coming leaders within the school. She's done an outstanding job at the Glennon Center. She's also been very well published now in education. She actually presented when I was at Brown, when I presented at a meeting on the accelerating excellence in education just a few months ago. And she's developing a reputation on her own. She's now an associate professor. She trained in Athens, Ohio for her DO degree, did her internal medicine residency program at Michigan State, and then a clinical fellowship in geriatric medicine at University of Michigan in Ann Arbor, as well as a special fellowship in advanced geriatrics in Ann Arbor and a clinical fellowship in hospice and palliative care at Ann Arbor. So she's eminently qualified, has been well respected, and was recommended by her chair, Dr. Robert Palmer, for this endowed professorship. Any questions related to her qualifications of the recommendation? Hearing none, I'll go to Dr. Hamid Akravi, who is being recommended as well for the Alfred E. Abenuis Distinguished Professorship in Geriatrics. Dr. Akravi is another outstanding young faculty member in geriatric medicine, researcher, clinician, working with Alzheimer's, is a director of the Memory Center, has been on the EVMS staff since 2007 as well. He also came to us through Michigan as well, and did his fellowship though at the Mayo Clinic, and is well published, and comes to by word of the recommendation of his chair, Dr. Bob Palmer, as well. Any questions related to Dr. Akravi?
He's an outstanding clinician and researcher. He'll do well for us.
Yeah, he's another up and coming leader in the school. Wonderful human being as well. The next is a list of established assets for naming. And if you click on that tab, I've worked with Connie McKenzie, the Associate Vice President for Development, to identify ways to be able to have naming opportunities throughout the campus. So that would be at $1 million or less. And so the board would then provide me the opportunity to be able to work with her to present these opportunities, and they're before you, for opportunities for potential donations as part of the capital campaign. Anything over $1 million, you should recall there's a policy that requires the board's approval. So any questions related to those possible naming opportunities that would provide an opportunity for me to be able to work with Ms. McKenzie to identify ways to enlist support and more funding for the endowment? Okay, hearing none, then I would recommend that the board consider on block voting on these items.
All right, so is there a motion to approve the action items as presented by Dr. Homan?
Motion.
All right,
Second.
is there a second? Great. Let's go to the roll call vote, please.
Mr. Hugh Cleese?
Yes.
Mr. Admiral Bianchi?
Yes.
Ms. Bishop? Ms. Bishop? Dr. Damon?
Yes.
Dr. Emory?
Yes.
Mr. Frame?
Yes.
Ms. Goodwyn?
Yes.
Mr. Lewis?
Yes.
Dr. Waldholtz?
Dr. Waldholtz is on mute.
Okay. Dr.
Yes.
Martin?
All right,
Oh, okay,
Waldholtz.
thank you. Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Warden?
Yes.
Ms. Moore?
Yes.
Dr. Joffrey?
Yes.
Okay.
All right, it looks like Dr. Lindsay is on. I don't
I am.
hear him.
Yes.
Yes. So, okay. So you're, Dr. Lindsay, do you approve?
Yes.
Thank you.
Okay, great. Thank you, everyone. All right, Dr. Homan?
The next is an informational item to the board. If you click on the tab report for the obligation essentially to ensure that we don't go into deficit from general funds. This is a requirement that we submit every year. On the last page of the two-page document, it says the heads of agencies with governing boards must provide each board member with a copy of this notice, and then it's submitted. So it essentially provides assurances to the state that we're not going to use state funding and go into deficit funding on the state's account. And, based on the Finance Committee's report, I can assure you that will not happen. So that's an informational item. I do not need a vote on that, but I entertain any questions if anybody has questions. Okay, hearing none then, if we can get my presentation up to the board. Bear with me here. This is going to be a longer report than usual because this is an annual report that's required by me based on the bylaws of EVMS, where I have to provide an annual report. So I'm going to touch on all the different domains within the school. I'm going to go through this relatively quickly because we have a lot of agenda items as well, and we've gone through all of the details on many of these, the Academic Affairs and Finance Committee and Audit Committee. So as you can see here, just on EVMS enrollment, we've had the increase over the last several years of enrollment, both in the health professions and the medical school. This has been an opportunity for us to maintain the finances of the school by having more tuition. The expansion of the medical school happened actually concurrently when I came, and those dollars for the tuition were encumbered before I arrived. And so a lot of the HP program tuition dollars have been the source of funding for the medical school, but the intent is to expand the number of students in order to meet the needs of the Commonwealth of Virginia in both medicine and the health professions, so we can provide opportunities to be able to serve the patients in the Commonwealth. I want to give you a couple of representative templates. I've showed this in previous years. You can see the number of applications. This is for the medical school applications. For the number of applications, about 7,000 roughly. It's hovered around that for the last few years. And then we have number of interviews, number of matriculants. The number of underrepresented minorities is hovering around 20%. We're looking to see, we still have people on the waiting list. We're not sure how that will turn out. We're identifying ways to try to ensure that we can allow us to be able to have the demography of the students in the school and the faculty and staff as well to reflect the community we serve. The credentials continue to be very strong on the MCAT and the GPA. So I want to thank those individuals that have been on the admissions committee, because this has been a very large amount of work, a lot of work that has to be done to this process, and we're maintaining, I think, a high quality complement of medical students. One representative example in the health professions is the PA program. And as you can see there, we have 1,200 applications, come down a little bit, but materially it doesn't make any difference really, because essentially we offered 98 positions for 80 slots. So, I mean, the yield is very high for those individuals that are coming. It's very high. The credentials, the GPA actually went up. These individuals already have at least 1,500 or 2,000 hours of volunteer work before they come here, so they're work ready in terms of the language of the health professions in medicine. And our students are doing extraordinarily well on the PANCE exam, which is the certification exam. On the graduate medical education side, Dr. Linda Archer is the one who coordinates this. She's done an outstanding job with her team. All the 30 ACGME programs are fully accredited. We have 2 new ones under development. One through plastic surgery residency program, which is integrated over 6 years, which has been helped to be funded through the Centera EVMS Academic Affiliation Agreement. And then we're also looking to develop a new child and adolescent medical fellowship. So a fellowship, especially in child psychiatry, with CHKD, and they have agreed to pay for the fellows and as well as to support the the underlying position. Because as you recall, they're creating a new psychiatric hospital on the campus, and we're woefully short of child psychiatrists in Hampton Roads and actually nationally as well. So this would be a great opportunity to be able to increase a workforce which is in dire need. On the GME side, we had a 98% fill rate through the match. There was one position that was filled through the supplemental match, so we had 100% match for all the residents. And we have some new integrated 6-year program for the surgical vascular surgery residency program as well. We're up for accreditation. Regrettably, in some ways, we were up for SACS accreditation for a site visit in April, but because of COVID, they deferred it. And so now we have the on-site visit in February of 2021, from February 16th to February 18th. And we'll get a decision the following December. That's for our institution. That's the institutional accreditation because we're essentially a health sciences university because we have a school of health professions and medicine. So that's the overarching accreditation. And then we have the accreditation of the medical school, which is extraordinarily rigorous, which is the LCMA. And they are coming now virtually in October. And then they'll have, after that virtual assessment, we're submitting their documents on July 1 for their review. They'll review those documents, do a virtual evaluation, and then based on that evaluation, they will make an on-site visit to be able to confirm or clarify any questions or deficiencies they identify. A lot of work. I want to thank Dr. Flenner, Dr. Mylona, Dr. Combs for all their work that they've done to be able to help to prepare for this. Let me stop there just for a moment, see if there are any questions, and I'll continue the presentation. Okay, match data, military match. We had 8 students for the military match. They all matched. Urology, which is very competitive. 3 of our 3 students matched. Ophthalmology, 2 of 2. And these are for the medical students. And we only had 2 students unmatched after the supplemental match process. That's about the national average. And so part of the unmatched numbers has been related to a mismatch of the expectations of the students with their credentials. Dr. Flenner's worked really hard to identify ways to coordinate and calibrate their credentials with the competitiveness of the residency program. And so we're still working on that. We had about the national match rate this year on the initial match and about the same after the SOAP. Research collaborations, there are many that we have. I'm not going to walk through all of these because it'll take a long time, but we have collaborations with other universities across the Commonwealth of Virginia. And one is the Virginia Biosciences Health Research Corporation. That's the catalyst. We have 3 active grants with VCU and ODU. We also have some other grants where through VRIC, and there's a COVID-19 special registry to identify the health disparities around in the Commonwealth, to identify where the burden of care and the burden of mortality and morbidity has been around the Commonwealth, so we can identify better ways to be able to case manage patients in vulnerable populations and regions in the state. The one under regional collaborations, that's the Hampton Roads Biomedical Research Consortium. As I remind you, that was a appropriation that was provided initially in the UVA, $4 million a year for 2 years, and a $10 million capital opportunity. And there was a consultant that came into Economy that gave us a roadmap to identify ways to be able to identify how we would structure this and what purpose. And we've done that. We're now in the process of developing an entity and then develop a 501(c)(3) around that so we can accept the state funding. Ms. Purcell has worked with the attorneys from ODU and Centera. We developed the org chart with, and I want to thank Dr. Wawselenko for his work as well, because he's on the committee with me. And that provides an opportunity to identify ways to be able to help improve the health through technology of patients in underserved areas. And then the healthcare analytics and delivery science, we have pilot grants. Over 3 years, we get about $100,000 per year. We've had 22 pilot grants, several of which have served as the basis for pilot data for submissions for national grants. The clinical enterprise, as you can imagine, has taken a little bit of a bump downward as a result of the COVID because of decreased utilization. We were on target to have a very, very strong year, but it looks as if this next year ending June 30th will come in about the same as that which we had last year. And we'll go through this a little bit as well in some of the other detail. I want to thank Dr. Kurt Stouter, who's now the new CEO of the practice plan. We're looking at improving and expanding our telehealth program and telemedicine program to provide training for all of our faculty to be able to deliver that, because that's a new delivery system that's been approved by Medicare and the third-party payers during COVID. I anticipate that's going to continue indefinitely. That's going to transform the way that medicine is practiced in the future. It's really accelerated the technology tools for the delivery of care. We're also expanding our capacity within our school itself by managing the schedules and accountability of our faculty. So we're hoping that next year we can continue to grow and have a margin that can be similar to that which we anticipated this past year. The capital campaign, as you may recall, we had an initial goal of 35 million. That was raised to 50 million because we're already at almost 40 million. And this has been an enormous effort from the development office. I want to thank Connie McKenzie and her team, who've been actively engaged in many of the gifts. I've been engaged in many of the gifts. There's another large gift that we're working toward that we may receive. More to come on that. I won't disclose anything because I don't disclose it until we know. But there's a big opportunity. But I want to thank all the Board of Visitors that have donated as well through the capital campaign and the annual fund as well. So all of you online, I want to thank you for supporting the school and supporting the health of the community as we work together to improve the health of Hampton Roads and beyond in Virginia. Let me just make a transition. We've made ramp up planning over the past 2 months. We planned for the ramp up. We never closed, just to let everyone know. We've maintained our operations, but we've had to re-engineer our educational, research, and clinical programs. I established a multidisciplinary ramp up task force. Dr. Don Combs is the chair of that. Multidisciplinary across the schools, different expertise, infectious disease specialists, public health specialists, administrators, etc. And we're looking at trying to find ways to be able to incorporate all of the benchmarks, best practices from AAMC, CDC, across the board to make sure that we do this in a safe, thoughtful, and expedient way, because the longer we don't ramp up, the more financial stress is placed on the school. So we're working on this, and it's worked really well. I have to thank the entire team at EVMS. I mean, it's been very difficult to manage this organization with over 2,000 employees having telephone meetings, 5, 6, 7 times a day. And but it's worked, and everyone's been very, very independent and creative in their approaches. So I want to thank them. So in that context, we have already ramped up the basic science and clinical research and clinical program. The concern for the research program was all of our federal grant monies had to be suspended. So we had people on the payroll, but we couldn't expense their salaries or their expenses to the grant because we had to pull back on the research piece. So we ramped that up on May 15th. And now everybody has to be social distance. They have to have a mask. They're all trained. Everyone has to come back to campus after having had a chance to be able to go through a training process. And there's screening processes as well as they come back. We're now in the process of ramping up and finishing the ramp up of education administration. That's on June 15th. There'll be medical student orientation on August 5th. And there are many policies and procedures we're developing. We've learned that some of the individuals on the campus have been shown not to be wearing masks. And so we actually have a policy in development now that will create a guidepost for all the faculty members. And it's in the context of if you see something, say something, meaning anybody can tell anybody, please respectfully put a mask on because it helps protect yourself, it helps protect your patients, it helps protect the community. If people are delinquent in that, there's also a provision for sort of graduated feedback, I'll say, and to make sure that they know that we're really taking this seriously, because we have to take the CDC guidance and guidelines very seriously as we continue to ramp up, as we have more students and more faculty, more staff on campus. One thing I do want to thank, you can see here some of the students and residents. There have been exposures. There have been, I think, 36 residents have been quarantined. There have been faculty that have been quarantined and exposed. We've eliminated, I think we haven't had any exposures in our clinical practices because we've had such a thorough screening process. And I want to thank, Dr. Abahamid and Dr. Stouter and Dr. Baumgartner for that, as well. I wanted to just make a note that I talked to President Broderick at ODU during the time we thought there was going to be an enormous surge in the number of patients in COVID in this region, which never happened, by the way. It was more of a gentle bump than a high spike. But we were concerned that a lot of the residents or other individuals, nurses or health professionals, might be exposed, and they may want to have a safe place to be able to convalesce, or if they're in quarantine, to protect their families. And so there was a dormitory at ODU that was provided for us that had about 80 beds. Brand Cox and Mark Babashanian helped to negotiate the process, but only a few residents have requested rooms there. And that's a good news because it shows that the surge really wasn't that dramatic as we had anticipated. So all the guidelines that we have for the ramp up and for clinical practices and for our campus are all based on data through the CDC, our infectious disease and clinical leadership protocols that have been developed. Let me stop there and see if there are any questions. Okay. You still with me?
Yeah.
Okay, very good. Next, I want to say, I want to just shout out at the students during the time that we were short of PPE, and this was very tough for us because we didn't have enough face masks for our front desk personnel and some of our clinicians that were in the hospitals. And Dr. Abahamid was able to get some materials and design a face mask, and the students were distanced and created over, I think, 500 masks that we still have available. We distributed a lot of those, but they did this in a Henry Ford kind of assembly model where they worked very hard as a way to be able to pull together and do something that was very meaningful to improve the safety of our staff, faculty, and residents, as well as to contribute to decreasing the risk of the spread of the disease. So this is just one example of many of our students doing such great work and contributing to the health of this region through their volunteer work. Brief financial review. The clinical enterprises, based on the COVID losses, it was going to be about $4.8 million. So our projected actual in 2020 is about 8.5. The budget was about 8 million. And we have next year anticipating coming back to baseline. That may be generous. We'll see. I know Dr. Stouter has been involved in projecting the volumes. I still see that there is decreased volumes in hospitals, emergency rooms, and patients are still a bit reluctant to come back to hospitals and to see their physician because they're concerned about getting infected. And that's decreased utilization nationally. But hopefully we'll work through. So we have capacity now because we're expanding our capacity by increasing the number of appointments we have available, and we've ramped up our telehealth program. We had to spend about $1.5 million for new expenses for just PPE. As you may recall, during the time when it was in short supply, there were bidding wars, whole series of things. It was hard to find it. We also had to add additional housekeeping to be able to provide sanitation for all of the administrative and clinical spaces. and had to decrease our fundraising targets because along with COVID came the market crack that went down, and that actually put a hold on a lot of individuals' enthusiasm to provide philanthropic support. Well, that's good news, and now the market's recovered, so there may be opportunities for us to continue the momentum that Ms. McKenzie and the development team put together. And we've also had an increase in some of the unemployment claims. That also includes individuals that used to work at EVMS that we have to pay for, because it's not only individuals that are employed through employment here that were furloughed, but it's also people that had employment here, left, and then claimed unemployment based on their prior employment at EVMS. So what have we done? What I've tried to do is to let all the faculty and staff know. We've had many town hall meetings electronically. Our first one had 750 or 850 people on it. We've had them every week or 2 weeks. Let everybody know where we are. This includes medical students, faculty, staff, and now we have smaller town halls with the different stakeholder groups. But everybody knows now we've suspended merit increases for all employees, not knowing how this was all going to affect the budget. We suspended budget requests for new spending. Everything was dialed down, hiring freeze, and we had some layoffs and furloughs related to the research enterprise. When the individuals were furloughed, they were eligible for unemployment benefits with the possible expectation to be rehired once the research enterprise came back. But I was trying to keep, because we're very lean, as you know. We've expanded our medical school class and our HP class by about a third, by over 500 students. And over the last 7 years, I have no increased number of clinical educators or educators in the school. So we've managed all the growth with all of those students without incremental hiring of our faculty. So there's not a lot of fat, okay? There's not a lot of excess. And so I'm trying to keep everything together. And I let everybody know the biggest asset we have at EVMS, as nice as Waitzer Hall is and Lester Hall is, it's not the buildings, it's the people that walk the halls. And we're trying to save jobs and maintain their capability to keep morale up, that we're trying to save their positions here so that we do not have to go through draconian cuts like other institutions have had to do nationally and regionally. The federal support, the CARES Act provided some funding for us for financial aid. This is based on a Pell Grant based formula. Pell Grants are grants for undergraduates, essentially, and we don't receive them. And so the formula provided very minimal amounts for us. So there may be a slide coming up, but the number of dollars that were available for ODU, for instance, was like 15 million or so. Half of the 330 million had to go to the students for financial aid. The rest could come to the medical school to support us during this crisis. And then for the medical group, we had CARES Act, it was Medicare funding, not Medicaid, Medicare funding, which was automatically provided to all practitioners in the United States based on their fee-for-service Medicare services from the previous year. That was about $700,000. We did apply and received a PPP loan, which was the Payroll Protection Program, and that's a loan. And we actually have an audit from KPMG and legal review to determine whether that is something or part or all or none can be converted to a grant. And so more to come. We do not know at this point. We're having that assessment now because we received almost $8 million in the PPP loan. And it's clear nationally, having talked to peers around the country, that anyone who has a loan or initially of more than $2 million is going to be audited by the feds. So what I wanted to do is have an internal audit process from KPMG and our legal team to review it, anticipating a federal audit to make sure that we know whether we're entitled to it or not. And if we're not, we'll have to pay it back. If it's a loan, it'll provide the cash flow for us to sort of bridge from here until we pay it back. If it's a grant and it actually comes back as cash, that would be a benefit, but we don't know. Legislative requests for 2020. As you recall, base adequacy is essentially the formula funding for all higher ed in the United States, in the Commonwealth of Virginia. And we were under base adequacy for 40 years. We are now the only institution in the Commonwealth of Virginia that is under base adequacy, under the formula. And they also discount the formula for us by 5% because we're not a full state agency. So we get sort of hit twice. They discount our amount by 5% because supposedly we're more efficient by not being a state entity, and we're below par as well. But we also asked for some increased funding, $1.7 million a year per year. We received $625, but that was rescinded after the COVID impact related to the decrease in the state revenue. We asked for funding for the new building, the Waitzer Hall, of $1.2 million, because that's what it costs annually as an operating expense. State agencies get that funding. We have to request it. It was unfunded. We also asked for other capital requests for Hofheimer, for air handlers and roofing and et cetera, and that was not funded. I did send a letter to the Secretary of Finance and Education, had a call with them as well, and I spoke to the Secretary of Education personally actually yesterday, let them know that we're a special case. As you all know, EVMS is not a typical state agency. We're kind of a unicorn, I call it. We're a special case. We're a political subdivision. We do not receive the benefits of other state agencies. We do not receive raises for our faculty that other agencies receive when there are increases in salaries. We have to generate that from our own income statement. And so I wanted to make it clear to them, anticipating that there may be budget cuts in the late summer, early fall, that we're a special case and that we want to make sure that we have the opportunity to make that case now before the budget cuts, if they are announced. Then there'll be a queuing effect of every institution in the Commonwealth going after them. So I wanted to make sure that they knew up front what our special circumstance was and ask for their consideration. Let me stop there and see if there are any questions.
No questions. This is Sarah Bishop, but Dr. Homan, I hope you can call on the board to help with any of the legislative issues. I'm more than happy to call or email. I don't have a lot of influence, but I'll talk to you when I know if I can help. I'm sure the other
Certainly. Well, if any of the board members know the governor, can reach out to the governor, Secretary of Finance, Secretary of Education, that would be beneficial. The more noise and the more appeals that occur to those individuals, the more likely people will recognize the value that EVMS provides to this community and the Commonwealth, because we're not as well known as you know. We don't have the brand that UVA and Virginia Tech have and VCU. And so we're a little bit hidden here in Hampton Roads. And the more individuals that provide that narrative to the politicians and the legislators, the better, including the governor. Thank you.
If I may make a suggestion, and I'm no admiral, okay, and I don't play one on TV, but I know that a bunch of fingers is not nearly as powerful as an organized fist. There are other organizations that have boards of visitors that have a standing political action committee, or they have a somehow organized approach to it. I believe VMI is very effective, and they have outreach probably daily or weekly to members of the State House and State Senate, as well as the governor's executive board. And I might suggest we consider doing something like that, because yes, Rick, you're absolutely right. We have to reach out adequately and regularly, but I think we probably need to do it in an organized fashion with an appropriate strategy and an appropriate set of tactics to underlie that or support it.
Well, yeah,
I don't think we've ever had that. And I think having you be there to help direct it, along with other people that are politically active, would probably serve us to be more effective.
Well, I would recommend, at least initially, to have a political advocacy committee, not a traditional PAC where you actually have a lobbying dollar amount that goes in, but to have a group within the board that has that as its focus, to be able to provide opportunities to be able to educate the legislators and the governors related to our value. That would be a great idea.
Mr. President, would this be a time for a motion?
Sure, certainly. That's your prerogative. You're the board members. Mr. Director?
Mr. Director, I'd like to move that we have a political advocacy committee established at the leisure and pleasure of the rector, and have a report to.
Yeah, is there any additional discussion on that? Sounds a good suggestion because I don't think we've been politically organized. Dr. Emory, any thoughts?
I think it's a great idea. I think that it's an area that at this time and going forward, it's going to be very important that we're engaged. There's going to be more budget cuts and we're going to be in more need than we already are. So I think it's a great idea.
So do we currently have a legislative liaison other than, Dean Holman's approaches to the various legislative members? Is there anyone on our faculty or administrative staff that is considered our legislative liaison? I'm assuming that Stacy is like a...
Yeah, I coordinate all the communications with the governor's office and the legislature, and we work through Kemper Consulting. Grant Cox helps me with that as well as a liaison with me, and it's just a consulting process. And they're hired to represent us. They can be helpful because they have the ear to the ground, but they don't have the weight that the board has and the knowledge that the board has and the commitment that you all do that can be passionate and provide a third-party advocacy to the legislature and governor.
And just as a point of information upon a question, go ahead. I'm sorry, Marcus.
No, I was going to say your proposal. I support it. Hold on.
Thank you. I think also as a point of information that you do not have to be a member of the Board of Visitors to potentially be on a committee. As I understand the bylaws, I'll defer to Sarah on that. But we also have a Board of Trust, and those folks do sway a little bit too. Have a little sway of influence in the community. We need lots of fingers to make lots of fists.
And I think it would be important to, as you say, the Board of Trustees to be engaged because I think that we need to sort of understand the tenor of what's going on in Richmond and in our own community in order to figure out what the advocacy goals and objectives should be.
Well,
We
I think
understand,
we
so who's lost?
There's a motion. Is there a second? I'm not the director.
Second.
Wait, the director has to put it forward.
Yeah, no, it's Mark, it's your turn, baby.
Yeah, Terry's last couple of sentences faded on. I didn't hear what she said, but I think the sense I get is that the board overall views that as a positive. So to the extent we need a motion to establish that committee, is there a motion and a second?
So moved.
So moved.
Second.
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 All right. Do we need a roll call vote on that?
Yes, we do.
Okay.
Mr. Hucles,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Dr. Damon,
Yes.
Dr. Emory,
Yes.
Mr. Frame,
Start again.
Yes.
Ms. Goodwyn,
Yes.
Mr. Lewis,
Yes.
Dr. Waldholtz,
Yes.
Dr. Lindsay,
Yes.
and Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Warden,
Yes.
Ms. Moore,
Yes.
Dr. Joffrey.
Yes.
Okay.
Okay.
Adam.
Great.
Go back to the slides, please. There we go. Okay. Thank you. So this is just a very high level slide indicating that we're going to need to draw down on reserves in order to support various initiatives. That's going to happen in the out years as well. Although this year we've had a good year, so therefore we have the capability of providing some funding into the medical reserves. I talked to the Admiral, chair of the Finance Committee as well, about in the event that we're not cut by the Commonwealth of Virginia's budget, there may be an opportunity to provide a minimal sort of recognition of everything that's gone on over the last few months with COVID to provide perhaps a one-time bonus for some of the faculty and staff. We'll have to see what the budgets identify, but we have some of the reserves to do that. We're gonna have to draw on reserves in the future as well. So very briefly on the operational impact of COVID. Number one is we had to have a virtual match day and a virtual commencement. I want to thank Vincent Rhodes, the IT department, the AV members as well. They've done incredible work to put everything together. We had very good feedback on match day. It was a drive-by essentially, where we provided the match envelope together with a Facebook poster where they could identify where they were going to go and have that posted on the web for their peers. And then we had commencement, which was done virtually online. I know the rector participated and a few of the board members did as well, and I appreciate all that work. We did the best we could, and I think exceeded expectations, frankly. I think the students really appreciated all the efforts that we had. We've had a suspension, though, of all events until at least through December 31st of this year. I can tell you that nationally, the AAMC meetings have been canceled through July of next year. The American Association of Medical Colleges, all the affinity groups for residency programs, for undergraduate medical education, for the dean's meetings, for the general meeting, the annual meeting, that's all been canceled for a year. So that's a national trend. So I'm not sure we're going to have a lot of travel, and we've already canceled travel among our faculty, but we're not going to have a lot because there's not going to be a lot to travel to because most of the conferences are canceled in medicine. We did re-engineer the educational program. Again, I want to thank Dr. Flenner, Dr. Brooke Hooper, Dr. Millie Kennercott. That whole team put together opportunities to be able to go online. Dr. Combs did the same in the School of Health Professions. So we moved didactic courses online and then identified ways to be able to create some research programs, to get credit. Very innovative, and did it on a moment's notice. And I want to thank them for their creativity, and as well as for the medical students and health professional students who were very patient in their educational process. Dr. Stouter mentioned we re-engineered the clinical enterprise as well. We have bigger telehealth program now that we never had. We have video and phone platforms. We've trained the faculty. We actually use students to use them as identify patients to schedule that wanted to get engaged. We have now a process to improve and increase the throughput in our clinical practices, but we have to make sure we do this in a safe environment. So we now have sufficient PPE. We've done changes to the workflow. We want to make sure patients are screened appropriately, they're safe, the faculty and staff are safe. It's worked out really well. We've had many, many meetings on this, and it's been very complicated. And again, Dr. Baumgarten, Dr. Stouter, Dr. Abahamid, Dr. Oldfield, many others were involved in this process. We also had to re-engineer the research enterprise, and Dr. Wasilenko helped to develop this. So we developed input with all the associate deans for research for Dr. Wasilenko, had seed funding for some of the team collaborations, and then we re-ramped up the federal funded faculty members here back on campus so we could expense their salary and their expenses to the federal grants. We do now have this HADC program, which is with EVMS and Centera, and also is involved with VCU. This is a statewide consortium that we've helped to participate in to identify the clinical parameters and disease outcomes of COVID. As you all know, the COVID-19 mortality and morbidity and the effects have been much, much worse in the communities of color and those that are underrepresented and socioeconomically disadvantaged. Part of that's the social determinants of health because they have a higher incidence of diabetes or obesity or hypertension or lung disease, but they also live in crowded quarters and smaller apartments, and they have more people where they have a likelihood of having disease. So this is going to help to focus what are the demographic issues related to COVID-19 across the Commonwealth. Hopefully this will target the public health efforts to identify better ways to be able to screen for patients, to be able to monitor them, the case monitor them, and identify ways to be able to keep the most vulnerable populations in the Commonwealth in this region safe. So we also have some partners with VCU. We have one with Inova and Carillion. I won't go through all of these. but more to come. This is one area the HADC has been very proactive because there's more funding now for COVID-19 research. And COVID-19 research is predominantly public health and community outcomes based research. It's not basic science predominantly. So we can take advantage of this, and we are. Quick facilities update. Our new building, Waitzer Hall. We've had some exposures from the construction teams. Our focus is on the podium. That is the area, the 3-story area. That's the educational podium. And we want that up and going by the middle of July so that we can get our students in during this next year. So we focused the construction programs and the managers there and Steve Ballard to say, finish that first because we want to have that operational. They have had some issues because some of their teams have had COVID and they'd have to take 12 or 15 of their workers off the workforce, and that's decreased their productivity. But we still think it's going to be completed, the podium will, by mid-July so we can accept the classes on August 5th. So that's good news. They really worked really hard. It's been coordinated. Mark Babashanian and Helen Asalius have helped to manage that with Doug Martin from facilities. Just to remind you, it's an 11-story tower. The podium to the left, as you can see in the schematic, is the educational arm. And the other is a decked area where you have parking. And then the top 3 floors are for academic and education administration. And this is where we're going to relocate our functions from Smith Rogers Hall, which, as you recall, was a dormitory for the women's dormitory for Lee Hospital a long time ago for the nursing school. And we're going to vacate that with the hope of selling that eventually. So this is the very quick summary. I've had conversations, and I want to thank Mayor Frame for his work, Harry Lester for his work. I talked to Chip Filer again about 2 or 3 weeks ago, and we're looking to see if we can refresh the offer to provide an opportunity for EVMS to be able to sell that property. There's an opportunity for us to retain some property for more construction in the future, and so more to come. We'll let you know when that becomes available. One item I just want to, and a special shout out as well I want to mention. These are the number of MD scholarships 2019 to 20. As you know, we're trying to identify ways to improve the number of scholarships in the school because we don't have a lot. And our students have to pay, substantial tuition, and we're losing some of the top tier students to other schools because of that. And we're losing a lot of the minority students to other schools that can provide scholarship funding. And you can see the distribution of the dollar amount for scholarship awards. But I want to make a special announcement to the rector, the Mark R. Warden Scholarship for MD students, which is established from the Richard and Carolyn Berry to honor and recognize Mr. Warden for his outstanding leadership at EVMS as rector and as board member for so many years. This generous gift will provide an opportunity to be able to improve the quality of our student cohort and identify ways to ensure that we can maintain the diversity of the school and identify individuals that are in financial need from disadvantaged backgrounds. So at this point, I'd like to just take a moment and thank the rector and Richard and Carol Berry for their generous gift.
Thank you.
Well deserved.
And that ends my report. Thank you.
All right. Thank you, Dean Homan. Any other questions or comments? All right, that was very thorough and informative. Thank you very much. It's been a busy year. So on that note, we'll move on to the next agenda item, which is a report from the Academic and Student Affairs Committee from Dr. Marcus Martin.
Thank you, Rector Warden, and again, congratulations on the scholarship, that honor in your name. That's awesome.
Yeah, thank you. Yeah, thank you.
The Academic and Student, so we met today And we approved the minutes of the March 10th, 2020 meeting. The committee also heard the report from the Vice Provost for Faculty and Institutional Effectiveness, Dr. Mylona. We approved appointments and promotions of Dr. Brooke Hooper, Internal Medicine, Dr. Paul Harrell, Pediatrics, Dr. J. Brian Comody, Nephrology, and Dr. Jessica DeLong, Urology. And they were all promoted from Assistant Professor to Associate Professor. We approved the new EVMS Facial Nerve Center. The Faculty Senate acknowledged the new center, that it fulfills the criteria of a center. They approved it by unanimous vote. And today the Academic and Student Affairs Committee reviewed and also approved the new Facial Nerve Center. Currently, it's the only center of its comprehensive nature in Virginia. And the goal is to include integration and expansion of services for facial nerve disorders, including surgical, non-surgical, radiologic, neurologic, and rehabilitation. We also heard a report from Dr. Flenner. He gave updates on the MD 2020 match. The graduation 2020, virtual graduation, was very nicely done, by the way. And he gave us the schedule of the return to on-grounds education for 2021. He spoke about the ERAS timeline and the fact that Step 2 CS, clinical skills, is canceled. LCME survey team visit, as we saw on a previous slide, is scheduled for October 4th through the 7th, and that will be virtual. And we also discussed the School of Medicine medical student transfer policy, which has already been approved by the Medical Education Committee. Dr. Knight gave a report on 3 policies that we will need board action, and we'll take those all together towards the end. Compact for the teacher-learner relationship. The policy outlines the expectations for EVMS faculty and students to abide by the AAMC's compact between teacher and learners of medicine and health professions, and this includes EVMS's language on anti-discrimination. We reviewed the policy, and we approved that policy, and we also reviewed the policy on non-involvement of healthcare providers in education. And this policy prohibits healthcare providers, faculty, or residents from precepting or assessing students with whom they have had a I'll pause for a minute. We may need someone to close the mic, but can you hear me good? Okay. And so this policy also is written to avoid disruption of a pre-existing patient-provider relationship due to a new educational assignment. We approved that policy, and we reviewed the policy on students' rights to professional learning environment. This policy discusses students' rights to professional and respectful learning environment, appropriate treatment, safety and ethics, and reporting of student mistreatment, and it prohibits retaliation and false claims. The report from the Vice President and Dean of the School of Health Professions, Dr. Combs, proposed the new Master of Health Administration degree with 2 tracks. Track 1 will be 43 credit hours over 2 years. Students enrolled in this track typically will have little to no experience in healthcare settings. But students in track 2 will already have healthcare experience, and that would be 42 hours of credit over 2 years. In addition, the Art Therapy and Counseling Program proposes to offer 3 standalone graduate certificates, which will provide continuing education for alumni and area art therapists. So these certificates are Advanced Cultural Humility, Trauma and Neuroscience Informed Art Therapy, Psychotherapy, Trauma and Neuroscience Informed Therapy through Counseling. We heard a report from the Vice Dean for Graduate Medical Education, Dr. Archer, including information on resident wellness, safety, and cultural humility. So in summary, we will need, we were asking for the board approval, and the recommendation for the approval from the Academic and Student Affairs Committee is for approval of faculty appointment and promotions as a the EVMS Facial Nerve Center, graduate degree program and certificates, Master of Health Administration, the Art Therapy certificates, Advanced Cultural Humility, Trauma and Neuroscience Informed Psychotherapy, Trauma and Neuroscience Informed Therapy, the policies, 3 of them, Compact for the Teacher-Learner Relationship, Non-Involvement of Healthcare Providers in Education, and students' rights to a professional learning environment. So, Mr. Warden and BOV, we thank you for your consideration of these items. They will all, we're seeking your approval for all 9 of those.
All right, thank you very much. Is there a motion to approve the action items as presented?
Moved.
All right, is there a second?
Second.
All right, great. Let's have the roll call vote, please.
Hold on.
Go ahead, start again.
Mr. Hughes,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Dr. Damon,
Yes.
Dr. Emory,
Yes.
Ms. Green,
Yes.
Ms. Goodwyn,
Yes.
Mr. Lewis,
Yes.
Dr. Waldholtz,
Yes.
Dr. Lindsay,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Warden,
Yeah.
Ms. Moore,
Yes.
and Dr. Joffrey.
Yes.
Did Richard Litton get included on that list? He is now on the call.
He on? Okay, he did not. Mr. Litton?
Yes.
Thank you.
All right, looks like the ayes have it. So thank you very much, Dr. Martin, for that informative report.
Thank you, sir.
And for your service as the chair of that committee. So our next item is the Finance Committee report from Rear Admiral Bianchi.
Well, good afternoon, everyone. We had a very busy session this morning. We have convened in a special session on May the 19th to go over the budget in detail and also talked about the impacts of COVID-19. And of course, you heard some of that from Dean Homan today during his report as well. During today's session, we approved the minutes from the March and meetings, and then we reviewed the financials through April. We voted on a state apportionment plan, which will seek a vote of the full committee, and then we also reviewed, which we will also review with full committee here. And both of those items we recommended approval. As far as our budget year to date, again, not repeating too much of what Dr. Homan stated, but we are seeing an excess of 17.3 million with 4.3 core net excess, and that's mostly due to salary, positive variances from salaries and fringes from vacant positions. You did see that there's some negatives in the budget regarding tuition and fees with lower enrollments in some of the health profession programs and also the COVID-19 expenses that Rick mentioned. The biggest impact we saw in the clinical enterprises, decrease in their margin, again, due to some patient not seeing as many patients, and of course, expenses due to COVID. So, fortunately, EVMS was having a strong year prior to the COVID environment, and again, we expect to have a positive bottom line at the end of the year. You saw some of the actions, which I believe were prudent, that the management took in response to COVID, hiring freezes, restricting spending, and so forth. So I believe from our perspective, management is responding very well in light of the environment that we're facing. Most importantly, all bond covenants are being met, and we expect to remain in compliance through the remainder of the year. So that's kind of the current financial situation. Sorry about that. Okay, given that, then we moved to vote on the state apportionment plan, and this is a document that the EVMS must file with the state for approval. It lays out how EVMS distributes funds to its affiliated hospitals and to EVMS practice plans. There were no changes to the prior years, but I will certainly open the floor for any questions, or Helen, if you'd like to make any comments about the plan before we vote. Any questions?
Rick, I've got one question for you. When it comes to this apportionment, is there any specific formula that puts us at disadvantage, to be disadvantaged compared to the other larger, more longer-serving academic medical centers in the state, or is this actually a fair distribution?
I think it's a historical one that's been going on for 20 years or more, and it's based on a formula, so it
Right.
is, I think, equitable.
And the reason I ask is because if it's been going on for 20 years, it's hard for me to believe that it's fair to us. that's why I ask.
We can take a look again, but I believe it's formulaic based on the state's calculations, so we can double check that.
Yeah. Okay. Thanks. Thank you.
Okay. Any other questions? So, Mr. Rector, the Finance Committee recommended approval of the apportionment plan, and we would seek a vote on this item.
Well, what I was going to try to do, you're going to present the budget as well, correct?
Yes.
Okay, I was going to wait and do a roll call vote for all of the action items at once.
Okay, that's fine. We can do that. All right, so then without further ado, we will move to the budget review. As I mentioned earlier, we met on the 19th of May to review the budget package. We also went through it again today. It does consider the impact of COVID going forward and so forth, the impact of the state appropriations, which, again, the dean mentioned during his conversation. And the Finance Committee did vote in our meeting today to recommend approval. And I would ask Helen now to present an overview of the budget to the full committee. So, Helen?
Great, thank you. I am going to do a short presentation. So as discussed, we met in May. We've gone through this with the Finance Committee, and I'm going to provide some highlights of the budget for next year. Get my screen to move. Okay. So we were in the middle of preparing the budget when COVID-19 hit. We start our budget process in January, and we had all the departmental budgets completed towards the end of February. So those budgets included 3% merit increases and funding for new initiatives. Once after COVID hit and the financial impact that it brought, we had to recalibrate the budget to address those financial impacts. And we're happy to report that we were able to have a core budget that is break even with the financial constraints that COVID provided. Some of those areas Dr. Homan has already discussed many of these, but we did include in next year's budget $1.5 million of new expense for personal protective equipment. This is the biggest area that we have seen a lot of fluctuation especially as as we have our ramp up plan. We're finding new areas that we need to provide PPE for, and so this is a never-changing number, but we're still confident that the $1.5 million will be adequate for next year. We also had additional housekeeping expenses. We hired 8 new providers, 8 new housekeeping staff to do a more thorough cleaning of our facilities to help protect our employees, our patients, and our students. We've had, as been reported, reduced patient care revenues and margin. We've also seen an impact from the investment operating income and the fixed income environment and overnight investments with the decreased yields that those are providing. We've also seen an increase on the annual fund and an expected increase in unemployment claims. As already reported, the things that we've done to help compensate against this would be to suspend all the merit increases for next year. We also suspended all the budget requests for new spending initiatives, except for those identified as critical. And we do have a hiring freeze, except for critical positions. And as Dr. Homan has reported, the highest priority that we've had is to minimize the impact on layoffs and furloughs, and we are happy that we've been able to accomplish minimal layoffs and furloughs to date. We do need to draw on accumulated reserves next year in order to support various initiatives, but even still with that, we are able to have an increase next year. You may recall back in 2012, we had $2.8 million in reserves, and we're expected to have $46.3 million next year. It is important to have those reserves, as we've seen in this financial and with the COVID-19 crisis, it was essential to have those reserves available to us to be able to sustain operations if needed. But it is also important to keep those reserves to be able to recruit faculty and staff and to attract some good talent for our chairs and senior leadership moving forward. So we do keep an eye on how much we have available in those reserves, and it is critical to be able to have those available to us. As reported, the budget for next year is break even. It does include almost $880,000 of institutional one-time funds that could be available if needed for next year as things are identified. The president has used these funds in the past to be able to provide support to some chaired faculty, and we have that expectation next year. It could also be used if we have to get additional funding for COVID, PPE, things of that nature. Tuition increases, this is similar to what we've had. It's consistent with what we've had in prior years. The MD tuition is 2% in-state and 0% out-of-state. And the health professions is 2% in-state, and for most programs, a 4% increase in out-of-state. We also have an additional $200,000 reserve to offset against any decreased enrollment, and also without knowing what COVID-19 is going to look like next year, we thought it was prudent to include that. As already reported, the state appropriation for next year is the same as fiscal year 20. We did have in our long-range projections to have an additional amount for operation and maintenance for Waitzer Hall that was not ever funded. And then we had $625,000 coming out of the General Assembly that was rescinded due to COVID-19. And we are monitoring what the impact will be next year with any potential cuts from the state, and advocating to not get cut as much, to protect where we currently stand. Facilities administrative cost recoveries, a $1.1 million decrease. This is mostly due to the Conrad program. This reduction was expected. They had some large awards that are coming to the end of their award period, and so we were expecting this reduction. They have 2 large submissions in progress, but the budget does not include any of those additional funding to be conservative, as well as a small decrease in the other non-Conrad programs. We did include a $246,000 reduction due to COVID-19. We don't know how quickly our research will ramp up and what agencies will look like next year, what their priorities will be for funding. So again, we thought it was prudent to include a reduction in this revenue line. The clinical 20% support, this is the 20% of the clinical enterprise margin that is provided to CORE. And the fiscal year 21 budget is $1.8 million. The original projected actual that we had in place pre-COVID was $1.7 million. So the fiscal year 21 budget is aligned with what we were projecting fiscal year 20 would have looked like if COVID had not if we did not have COVID. The adjusted projected actual for fiscal year 20 is approximately $700,000. So we have seen an estimated reduction of $1 million due to COVID. As reported, we've suspended the employee raises for next year. When we were looking at health insurance, our consultant had recommended that we have a 10% rate increase, but we limited that increase to 7.5% by using funding from accumulated reserves. for health insurance. We are projecting to use $1.2 million out of the $9 million we have accumulated in these reserves. We really felt it was important to limit the rate increase to our employees, especially in a year where we were not having raises. On the GME program, we have a 3% resident increase, stipend increase. This is to remain competitive with the market, and it is also funded by our affiliated hospitals and has been approved by those hospitals. We are budgeting an increase from 353 residents to 374. The operating margin, the fiscal year 21 budget is $13.1 million. Again, the projected actual pre-COVID was approximately $13.2 million. So again, the budget for next year is aligned with where they were trending for this current year. The adjusted projected actual for the clinical enterprises is $8.5 million with an estimated reduction of $4.7 million due to COVID. In sponsored research, this is the direct cost component of the research that I just talked about a few minutes ago with the facilities and administrative cost recoveries, the indirect portion. Again, Conrad program, we are expecting to see a decrease in their direct expenses, but this was expected due to their two large awards coming to an end. And then we also have a slight decrease in the non-Conrad funding of $384,000. And then in the department reserves, we're basically budgeting the department reserves to be flat at $251,000. We have $60 million in department reserves. That was as of March 2020. But these funds are already committed. They include things like the chairs funds, student fees, also the insurance reserves that we were talking about for the health insurance. This is where those funds reside. And then lastly, the total institutional uncommitted reserves are projected to be $46.3 million at the end of fiscal year 21 for an increase of $3.1 million during the year. And that's just a brief overview of the budget.
Okay, thank you, Ellen. So as I noted at the beginning of this, we believe it is a realistic budget in light of the situation. The uncommitted reserves certainly give us a backstop for any uncertainties in the near term, but as all of you know from the session we had where we looked at the out years, it does not obviate the urgency to seek improved levels of funding from Centera and other state appropriations and so forth. Those reserves will dry up very quickly if we don't start getting some cash infusion from these other sources. However, given the current situation, the Finance Committee does believe that the FY21 budget is sound, and we recommend approval by the board. If there's any questions. All right. Okay.
I have one question.
Oh, I'm sorry.
I have one question. That 7.5% on the health insurance, what's that average out to most of the employees? Is that $10 or is that $200?
I think it's less than 100.
Thank you.
Just as a point of information, at what size is an organization large enough to begin considering self-insuring or self-insuring with backdrop insurance of some sort of larger catastrophic expenses? I know there are groups much smaller than we are that are medical groups that are self-insuring, be it Urology, Virginia, and other groups that are saving a ton of money and are utilizing that sort of an alternative approach to their insurance costs and coverage.
We are self-insured, and we do have the stop loss coverage, and so that is a very beneficial program because we are actually only incurring the expenses as they come, and the accumulated reserves that we have available to us are from positive experience years.
Great, because it's never been presented that way. That's marvelous. Thank you.
Yep.
Yeah, sorry. The recommendation comes from our advisor who helps manage the program. So it was we consult with them on the actuarial analysis and everything.
Super, thank you. That's great.
When you were estimating, when you were estimating 100, is that a single employee coverage or is that family coverage? You're 100 up.
I believe it's the impact on the family coverage. So
that makes more sense. That makes more sense.
And just to confirm, that's the reserves is that 9 million number you said, correct?
Yes, that is correct.
Great.
All right. Any other?
Okay, great. Then I would propose that we take a vote on both the actions, Mark, for the state apportionment plan and for approval of the FY21 budget as presented.
Great. Is there a motion to approve the action items as presented?
So moved.
Is there a second?
Second.
Thank you. May we commence the roll call vote, please?
Yes. Mr. Hughes?
Yes.
Rear Admiral Bianchi?
Yes.
Ms. Bishop?
Yes.
Dr. Damon? Dr. Damon? Dr. Emory?
Yes.
Okay. Mr. Frank?
Yes.
I'm here. It's Dr. Damon. Yes, yes, yes.
Okay, great. Thank you. Ms. Goodwyn?
Yes.
Mr. Lewis?
Yes.
Dr. Waldholtz?
Yes.
Dr. Lindsay?
Yes.
Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Warden?
Yes.
Moore?
Yes.
And Dr. Joffrey?
Yes.
Great.
Okay. Thank you. And thank you, Rear Admiral Bianchi, for your service as the chairman of the Finance Committee. All right. Our next agenda item is a report from the Audit and Compliance Committee and Sarah Bishop.
Thank you. Good afternoon. The committee met, of course, electronically today. We heard from our KPMG auditors. The audit plan remains on schedule with really no changes to the audit programming. We heard from Barrett regarding the EVMS internal audits, our risk-based audits, and our annual audits that include things like indigent petty cash. They basically all remain on schedule, slight delay on some that, for example, student financial aid because of the COVID. But we got a report on all of our internal audits. We had a compliance report from Stacy Purcell on the annual staff and faculty training, which is also on schedule, probably a slight delay due to COVID, but that remains on schedule. You have in your package, there are 6 policies that you have in front of you. We reviewed those. Point of information on the diversity, that is not a new policy, it's a reaffirmation. It was looked at to make sure it was in alignment with everything else at EVMS. There are really no changes. It's a good look at that policy to make sure it's appropriate and aligned. There is one change, Rector, regarding the asset naming policy. So before we go to vote, I want the board to know we altered that to allow the president of EVMS to name the current policy that you received in the mail said someone to have something named that had to be dead. And we removed that stipulation allowing for the president to approve a change for someone who has not deceased. So there's
Sarah, that was
That was updated between the meeting and this one, so if everybody has current board books, it will be correct in the reflected in the policy.
Oh, thank you, Stacy. And then the other that you see beneath those 6, the board by our bylaws is required to approve policies that are deleted. Well, those policies being deleted are because we have a new authorized driver policy. So it's deletion of old, approval of new. So I have for you, Rector, those policy changes with a note regarding the asset naming. You're muted, Mark.
All right, here we go. Are there any questions on any of that for Sarah Bishop? All right, seeing none, is there a motion to approve the action items as presented?
Motion.
All right, second.
Second.
All right, thank you. Maybe begin the roll call vote, please.
Yes. Mr. Euclid?
Yes.
Rear Admiral Bianchi?
Yes.
Ms. Bishop?
Yes.
Dr. Damon?
Yes.
Dr. Emory?
Yes.
Mr. Frame?
Yes.
Ms. Goodwyn?
Yes.
Mr. Lewis?
Yes.
Dr. Waldholtz?
Yes.
Dr. Lindsay?
Yes.
Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Warden?
Yes.
Ms. Moore?
Yes.
Dr. Joffrey?
Yes.
Okay.
All right, sounds like the ayes have it, and so those action items have been approved. Does that finish up your report for the Audit and Finance Committee, Sarah?
Yes, it does.
All right, thank you. We'll now move on to the Governance Committee, also chaired by Sarah Bishop.
Yes, this is an exciting thing to bring forward. I want to first thank the Governance Committee that has really worked and had a very serious look at the planning for leadership and having appropriate succession, a very important responsibility that we have as a board. I also want to thank every member of the Board of Visitors who had input either through a phone call, an email, or completed a survey of letting the committee know their own interest or their recommendation for any leadership position, whether it's as an officer or a committee chair. We heard from most of you, and it's exciting to see the level of engagement and interest. So I am thrilled to announce to the board that we have a slate of officers that we are recommending to the rector and to the board for approval. That slate includes, as rector, Dr. Teresa Emory, vice rector, Dr. Marcus Martin, secretary, Sarah Bishop, and treasurer, Admiral Robert Bianchi. That is the slate of officer for this coming year.
Perfect.
And it's coming to the board as a recommendation.
I'd like to
Sarah,
move
please.
adoption.
Sarah, please include the assistant secretary in that vote as well,
Yes,
please.
absolutely.
Thank you.
Yes, Tracy as the Morgan as the assistant secretary. Yes, thank you very much.
I'd like to move for adoption.
Second.
All right, maybe commence the roll call vote, please.
Yes. Mr. Euclid?
Yes.
Rear Admiral Bianchi?
Yes.
Ms. Bishop?
Yes.
Dr. Damon?
Yes.
Dr. Emory? Dr. Emory?
Yes.
Okay. Mr. Frame?
Yes.
Ms. Goodwyn?
Yes.
Mr. Lewis?
Yes.
Dr. Waldholtz?
Yes.
Dr. Lindsay?
Yes.
Mr. Litton?
Yes.
Dr. Martin?
Yes.
Dr. Wagner?
Yes.
Mr. Warden?
Yes.
Ms. Moore?
Yes.
Dr. Joffrey?
Yes.
Great.
And Rector, there were 2 more items that were discussed at this meeting. One is the survey. As board members who were with us a year ago, we had a survey of all board members. A requirement that we have, a responsibility we have, is to assess our own personal performance, but that of the full board. You'll remember that last year you had an electronic survey that was sent to us. It was 34 some questions. They went along certain themes of participation and how the meeting runs, and you will have that coming before you again. It was recommended that we add some questions regarding interest in legislative. I'm thrilled that Dr. Wagner pushed that even faster on us, and I deeply appreciate that. Legislative engagement, and also the interest from that was suggested by Dr. Martin, that we look at a board retreat, not institutional, excuse me, a board of visitors retreat to really do a deeper dive into some issues of importance to us. So you will see questions that relate to that on the survey. Please keep your eyes and ears open for that. Your input is essential. We look at it and we help prepare educational sessions based on your input. This is your board. We look forward to your input. And that's it, Mark, as you get ready to step down. Thank you.
All right. Thank you, Sarah, and thanks for serving as chair of the governance committee as well.
A lot of fun.
All right, so the next item is the rector's report. So I'm going to give part of my report now, and then we'll go into closed session, and I'll conclude my report in the closed session. So, but I have a few comments to share with the group. So the last year has certainly tested EVMS in several ways. First, there was the yearbook issue last spring, which was kind of a curveball. Then the school and the world found themselves in a public health crisis unlike anything witnessed in about a century. And each time, EVMS has demonstrated an unwavering determination to do what's right. So in the wake of the yearbook disclosures, President Homan laid out plans for a strategic plan specifically focused on diversity, equity, and inclusion. Hundreds of people from across campus responded to that, offering creative and innovative ideas. And you may recall in September, we approved the results of that effort, which was a comprehensive 4-year plan with a budget of $7.3 million. That plan builds on a commitment to diversity and inclusion that has been evident since Dr. Homan first came to EVMS. We saw that commitment bear fruit last year, first when the school won a national award for its progress in diversity and inclusion, and then in the fall when EVMS welcomed its most diverse class in history. We still have much to do over the coming months and years, but these developments certainly are promising, and we all look forward to what the future holds. So adversity struck again earlier this year when the pandemic hit. EVMS again responded quickly and decisively. The entire EVMS family demonstrated both a remarkable ability to adapt and an unrelenting determination to help others. And let me give you some examples. So EVMS faculty and staff made a rapid shift to a dependence on virtual communication for teaching and caring for patients, both Herculean tasks. They toiled on the front lines with fellow healthcare providers. They made themselves available to the news media countless times to help the public understand the new global threat and to safely adjust to life in a pandemic. Students also reacted quickly. They adapted to the new learning modalities and found time to help others. They volunteered in force to make face shields, as we saw earlier. They delivered vital supplies to daycares, provided child care to frontline healthcare providers, and do whatever they can to support the community. President Homan and the administration continue to labor diligently to continue to operate the school in an extraordinary time in our nation's history. As I conclude my service on the board, I believe the school is in good hands. I remain confident in Dr. Homan and his leadership team and their shared vision for the institution. EVMS was created by the community and for the community, and that indelible link to the community remains as strong as ever. And I want to thank you, my fellow board members, for your steadfast support during my term as rector of the board. And I feel very fortunate to have served alongside all of you. And this group is certainly gifted and talented. And so it's been my honor and privilege to be a part of you and appreciate the opportunity to work with you. I'm quite confident that the board will continue to move EVMS onward and upward. And so I'll miss seeing everyone, but look forward to, keeping tabs on how things are going. And I know they're going in a very good direction. And that concludes my report in the open session. Thank you. All right, so I don't have any old business, but I guess does anyone else have any old business? Or if not, I'd like to move on to new business in a closed session. And so I'm going to request for a closed session as permitted under Code of Virginia 2.2-3711A22 to discuss specific proprietary business-related information pertaining to the operations and finances of EVMS. And so I'm going to ask for a motion to go into closed session. Is there a motion?
Motion.
Is there a second?
Second.
Okay. Do we need a roll call vote for that?
Do a roll call.
Yes. Yes.
Okay.
Okay. Mr. Hugh, please.
Yes.
Rear Admiral Bianchi.
Yes.
Ms. Bishop.
Yes.
Dr. Damon. Dr. Damon.
Yes.
Dr. Emory.
Yes.
Mr. Frame.
Yes.
Ms. Goodwyn.
Yes.
Mr. Lewis.
Yes.
Dr. Waldholtz.
Yes.
Dr. Lindsay.
Yes.
Mr. Litton.
Yes.
Dr. Martin.
Yes.
Dr. Wagner.
Yes.
Mr. Warden.
Yes.
Ms. Moore.
Yes.
And Dr. Joffrey.
Yes.
Tracy, can I have everybody stand by so I can get the
Yes.
holding
If y'all
graphic
can just give us just a moment and we'll go into closed session.
Are you gonna let us know when we're ready?
Yeah, almost.
This is the topic.
Technical difficulties.
Weird. Live. Information.
Thanks for the slides, though, Adam.
We're good. Go ahead, Mark.
Thanks for this.
Okay, all right. So, is there a motion to come out of closed session and certify that only those matters that were identified in the motion convening the closed session were discussed and considered? Is there a motion?
So moved.
Is there a
So
second?
moved. Second.
Second?
Second.
Thank you. All right, roll call vote.
Okay, Mr. Hucles,
Yes.
Rear Admiral Bianchi,
Yes.
Ms. Bishop,
Yes.
Dr. Damon,
Yes.
Dr. Emory,
Yes.
Mr. Frame,
Yes.
Ms. Goodwyn,
Yes.
Mr. Lewis,
Yes.
Dr. Waldholtz,
Yes.
Dr. Lindsay,
Yes.
Mr. Litton,
Yes.
Dr. Martin,
Yes.
Dr. Wagner,
Yes.
Mr. Warden,
Yes.
Ms. Moore,
Yes.
and Dr. Joffrey.
Yes.
Okay, so we are out of the closed session, back into regular session, and if there's no additional business, the meeting is adjourned. And I just want to say again that it's been a pleasure serving with all of you, and thank you for your commitment and dedication to EVMS.
Thank you, Mark.
Thanks, Mark.
Thank you, Mark.
Great job,
All
Mark.
right.
Thank you very much for your
All right,
leadership.
thank you.
Thank you.
Bye-bye. Everyone have a great week.
Stay well, everybody. Keep the
All right.
faith.
Thank you.
See ya. Bye-bye.